All right, good morning, everyone. Going ahead and call this to order. This is our Board of County Commissioners Committee of the Whole workshop, August 11th, 2022. It's 9:04 a.m. Please turn your cell phone to the silence or off setting. We'll have no public comments this morning unless a board member brings you up, because this is a workshop for the board. We're going to go ahead and start with the Pledge Allegiance to the flag. Please stand and join me for the pledge. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, good morning. Has the meeting been properly advertised?
Mr. Chairman, this meeting was advertised on August 4th, 2022 in the Escambia Sun Press in the board's weekly meeting schedule.
Thank you very much. The Escambia Sun Press. Very, very thankful for that publication. Great publication, by the way. All right, we're dropping item number 3. Just got told that. So we've got, we still have items though. Wes, as we had discussed, I'm adding a new number 3, and it's going to be a discussion on our DOMS, the medical examiner. I've had a series of meetings this past week with Dr. Oleski and with Dan Schiebler. I know that some of my counterparts have had meetings. They just need a little direction, and so we'll have that discussion third. But we're going to start this morning with a discussion on homeless issues. We've got money set aside. It's a problem in the community. I don't know about your offices, but my office is getting a lot of complaints about aggressive panhandlers, people loitering in communities, people starting fires very near to subdivisions and communities. In fact, we had a very bad one on Highway 98, which came very, very close to destroying a subdivision. So we've got issues. The city's moving forward with several different plans, and so I had been for a couple months trying to get a meeting scheduled, a joint meeting with the city. We had called Mayor Robinson. No one could get their calendars synced. Last week we had a discussion on this dais about it, and the feedback I got was that we needed to have a discussion here first before we workshopped with the city, even though any meeting with the city would be simply a workshop, no funds would be committed. So that's the reason that we're having this meeting. So I want to get feedback from board members and figure out who would like to put forward some ideas, put forward a plan. We've got 4.1 million. In speaking with Liz this morning, there's tremendous amounts of additional money that are available, grant funding, and we're going to talk a little bit about that as well. Grant funding that could bring additional millions of dollars to Escambia County to help address this issue. So that's the first part of the discussion. Wes, anything you'd like to add to that?
Yeah, Mr. Chairman, if I could, before y'all start your discussion, I'd just like to say what we have done, as county staff has done. About a month ago, I went to a meeting with Sheriff Simmons and State Representative Salzman, who asked me if we could create a dashboard, a shelter dashboard that could be utilized by law enforcement, by the different agencies, by the general public, by the homeless population themselves, to be able to see how many beds are available in which shelters, and also total number of beds available in each shelter. And so knowing that we had some other dashboards going, I felt like that was something that we could do. And I just want to give props to IT, Bart Siders and Dave Myers especially. In 2 weeks, they had this dashboard, the concept done and up and ready to present. And then since then, they have built the back end of the dashboard for the shelters and the agencies to populate the information about their particular facility or shelter. And it's as easy, in less than 5 minutes, they could populate daily on what they need. So this data that's here this morning that's displayed, it's not real-time data. This is just representative data. But you see the dots, and Bart, I'll just let you take it from here and how it works. But it's a neat tool. I know the sheriff's extremely excited about it. State Representative Salzman is extremely excited about it.
So the theory is that anybody in the community or a sheriff's deputy, from their truck or vehicle could just look on this dashboard and see where there are facilities available. We started out, it was a homeless dashboard. I think the more we've met with different people, this could easily become a shelter dashboard of some sort that would have all the shelters that we have available with filters that they could look at. Bottom line is, you can just, like a sheriff's deputy could, highlight over a site, and once we get all the data from each of the sites. It could have a little caption underneath in a notes field that would tell them, it accepts women only, men only. We accept children, no children. You have to be alcohol-free, drug-free, that kind of thing. Whatever they want to do in the notes field, so that a sheriff's deputy could look at that and know where they would go. So they can do that. They can just scroll in and out. It's just a little GIS map that's tied in there. It tells them the total beds available. The other thing we did is just tied for future looking at it, is to be able to get some trends going. So, once we get data in here, it'll show you a month out what our trends look like, how many beds are being used each night, how many beds are not being used. We can add to this. We met yesterday with several of the entities and told them we want them to help us develop this. We were just asked to throw a dashboard together. We did, just looking at a sheet of paper that they had saw it somewhere else, and we said, hey, we can do this. So we know we can get it done. It's just now getting the data from each of the entities. We've already had 2 of them reach out to us this morning, so we've sent that. So hopefully they'll start updating this and getting there. So it's like Wes said, they'll each get an email, tell them how to log in. They'll log in, put their data in, and then it updates every 3 hours on this dashboard right now, and it'll keep it up to date. So it's a picture in time every 3 hours.
Thank you, Bart. Yeah, the sheriff.
Mr. Chairman?
Yes.
Well, excuse me, I have a few questions. So, Bart, so this dashboard is in collaboration with the service providers for the homeless? Is that how this is working?
Yes, sir.
Because I hear the sheriff, and that
Yeah.
it's criminal to me, but how do we access for services?
So the services, so what we're doing is we met yesterday with several of them. I'm trying to think of the West, you remember the names? It was, anyway, there was 3 entities there yesterday, but they're reaching out to all the entities that they work with. So we know of 9 that are pretty active, but there are some other ones. Some churches have some homeless shelters, Olive Baptist and different ones like that have some that they're reaching out to get them added into this list as well. But we are asking them to help us build this to what they really need it to be, because we don't know their business, but we're trying to help the sheriff's deputies have a picture where they know where to go, and then they can feed us data to input in.
I mean, yeah, and that's fine. I'm not really interested in the sheriff department having the data, because that's when they arrest people. I'm interested in if we have a dashboard that says that Sylvia Tisdale is feeding here. I'm interested in knowing if community health is providing vaccinations there, or if people are in health disparities there. So, I mean, I like where you're going with this, Bart. I honestly do. But I would want to know, the continuum of care. Are we working with the homeless task force? How are we making sure that we're not duplicating services?
Yes, sir.
And we have one unified front on homelessness.
So based on the discussions yesterday with those entities that were there,
Who are the entities over there?
and I don't have their names in front of me, but it was
Travis, are you here?
Waterfront Rescue Mission was one. The REAP that they run 3 or 4 of the shelters.
Travis is one.
What was the other one, Travis? Opening Doors were the 3 that were there yesterday. Opening Doors was going to reach out to several of the entities that they work with and ask them to give us their login information so we can set them up to start collecting data for them. REAP was going to get with us this morning to get all their login information so they can start updating. But the other shelters at this point, this was mainly focused on homeless. But I think after the meeting yesterday, I think everybody sees kind of where you were, we've turned this more into a shelter where we could add filters on the side of the, out here on the side, where if you wanted to see homeless shelters, you click there. If you wanted to see, feeding shelters or whatever they're called.
Right, because most of the homeless are not in shelters.
Right, understand.
They're not in shelters.
Right.
So Travis, maybe you can help, because Bart's IT and you're on the social services side. I see John Johnson here, Claire, maybe. So I've probably been around, this side of the fence my entire life. Hadn't we been working, isn't there a database of working with homelessness? Hadn't there been some type of systems that have been set up? I know we've done the counts, we've looked at the unmet needs. Is this a duplication of services, or is this something new that doesn't currently exist?
No, sir, I think that this is, what this does is it shows awareness to what kind of shelters that we have. And then, so we have women and children shelter. We've got Waterfront, which is a more of a faith-based type shelter. And so there's criteria that needs to be met to go into all of these different types of shelters. So what this really instrumentally does, shows the beds available that we have in the community, but maybe to an extent, maybe the lack of beds that we have in the community as well.
Right, which we all know that. I mean, I'm just trying to see, how do we measure this? I mean, what's the intended outcome? And, you know, for me, I mean, if no one else is doing this, then that's great. But if it's a duplication of services, I mean, I'm not interested. I mean, Jeff, I'll just tell you, I'm not going to vote for $1 more for another study or assessment, you know. I know what homelessness is when I walk out down on Palafox or when I walk to Brownsville. That's what I know. And so if we're not expending a lot of resources and we're doing this in-house without cost, you know, thumbs up. I mean, if we're spending dollars, then for me, thumbs down. I mean, because we've studied homelessness since I've been on this board. I mean, it's implementation, in my opinion, but maybe this is good. But I mean, I certainly, Bart, don't want it to be where we're just doing it for the sheriff's department. I mean, incarceration is not going to solve homelessness. Prevention and programs is going to help with homelessness.
Understand?
Yes, Commissioner, we've not spent any money to create this dashboard. I think the intent, even though it was asked for from Representative Salzman and Sheriff Simmons, I think the intent from Sheriff Simmons is not to arrest, not to have to arrest, but have a resource available where they can see where to help place some of these folks that may need some assistance.
How does this tie into the continuum of care that they're doing with the homeless task force? I mean, what's been their input on this dashboard?
Well, my understanding, and I was approached by, like I said, the sheriff and Representative Salzman, there seemed to be some frustration that they've been asking for a tool such as this
Right.
for about a year and hasn't been able to come to fruition.
Well, that's disappointing.
And so when they asked us to be able to, if we could assist, I said, yes, we could. I think from Representative Salzman, she's looking at this for data and information and for agencies that are willing to participate and provide the data. And also maybe looking to see who participates as it relates to funding with state monies and such. So we, you know, when they asked if we could do it, I knew we could, and so we did. But it has not cost us any money other than staff time.
And I appreciate that, Wes. Just, you know, for my support, I hope that we bring all the variables that are important. Not just for the sheriff department. I mean, for services and programming. I mean, it's a mental health component. It's a drug component. I mean, 90% of the people, I don't need a study to tell me, 90% of the people that are, you know, they have drug addiction, they have mental health issues.
Yeah,
I mean,
absolutely.
so that has to be a part of the component other than, you know, identifying them for law enforcement.
Absolutely. I think the vision as it's forming, I think, is multifaceted, not just for law enforcement, but for the community as a whole, honestly.
All right, thank you, Lumen. Commissioner Underhill, you're recognized.
Thank you, Mr. Chairman. I definitely would not be able to participate in anything about that kind of a strange dialogue where the sheriff's job is just arresting and it's all about crime. The sheriff's office is our primary tool for public safety. And in the discussion that we have, I mean, I like the idea here in that it gives the sheriff's deputies opportunities for de-escalation when the homeless population and some of their activities have a negative impact on our residents. It's important that we remember, and this is a data artifact that's very hard to find, but the reality is that most of the homeless in Escambia County are not Escambians. They didn't grow up here. Homeless populations tend to gravitate toward communities that provide a lot of resources with no or limited expectations from those people for the services that they receive. We unfortunately have been on that path for many years of providing more and more and more. You can get easily, 5 or 6 hot meals a day here in Escambia County and get a free bus ride around to get them. We have been very generous, which is reflective of who we are as a population. But we are now seeing an increasing level of interactions between or negative impacts of homeless activity on the tax-paying citizen.
Correct.
We have to give our deputies tools to be able to diffuse those situations. If we do not, then those situations will continue to escalate into the point where they are not reflective of who we are as people. So great tool for that and meeting that part of it. I will hope that, Mr. Chairman, as we talk about how we utilize that money, that we really focus on how to utilize that money in such a way to decrease the negative impacts of homeless conduct on the taxpaying citizen of Escambia County.
That's where I'm at.
That is something that, unfortunately, we have not been able to really get into and really approach the problem from that point of view.
But I think you can do both.
Yeah, absolutely can. There's no question about it. It's not two things can be true simultaneously. But that aspect of it gets de-emphasized.
Correct.
All too much here in Escambia County. So I look forward as we move through this discussion to really focus on how do we give these people, the ones who want help, how do we give them the help that they need? The ones who do not want help, how we give them the opportunity to leave our community, and all the while protecting the citizen who is the taxpayer and the primary equity holder of Escambia County. Thanks, Mr. Chairman.
Mr. Chairman.
Yes.
I'm not interested in people that want to build a wall around Escambia County and keep people out. It is the United States of America. So those are ludicrous statements, in my opinion. But if you follow the crime data is not at the shelters. It's what's happening, you're right, in neighborhoods, in tents, and out. I mean, so when you look at a dashboard looking at the shelter, that's not where the crime is. I mean, you can sensationalize it and scare citizens, but that's not where the crime is. The crime is in the streets. It's on Palafox Street. It's out in unsupervised, uncontrolled environment. So I'm not going to let someone describe a narrative that just doesn't exist. It doesn't exist that the crime's there. And so if we're going to take a holistic look, we have to take a holistic look at homelessness. So that dashboard has to include that. If it's about crime, you got to go where the crime is. And so bring the data points of where the crime is actually happening. And I guarantee you it's not at Waterfront Mission, it's not at Loaves and Fishes. But it is crime, but we need to go where the crime is.
Yeah, absolutely.
Mr. Chairman, and that is exactly why we should have tools like this that allow our deputies to move the homeless population out of the street and into these facilities, because in these controlled facilities, and you've mentioned it yourself in terms of places where there can be some level of supervision, some level of security, of even some requirements. With regard to drugs and alcohol, you look at what's been done at Satoshi Forest. They're very strict about conduct there. We do absolutely need to move our homeless off of the street and into those environments. And those who choose not to live up to the standards of those environments, there should not be a place for them on the streets of Escambia County.
Yeah, and I appreciate those comments, and I'm right there between you guys. I mean, figuratively speaking, metaphorically speaking. My thing is I'm getting a lot of calls, I'm getting a lot of complaints. And the citizens know we have $4 million, a little over that, for this problem specifically. And the city has moved forward with a number of initiatives, I'll call it that, some of which I think are very good, some of which I think are not great, and I would never support. But meanwhile, we've got the money, and we've got citizens, and we have complaints. Off of Highway 98, there was a very bad fire that required a lot of our assets to put out as a result of a homeless camp and illegal fires being started, and campfires, and one got out of control. So I want to help people that want help, but I want to make sure that folks who are living a dysfunctional lifestyle of self-destruction, drug addiction, if they want help, I want to be able to help them. But if they are happy where they are, and it's my understanding there's about 30% of the homeless people, maybe even more, that don't want help. They want to continue to take drugs. They want to continue to stay on alcohol. They want to keep living the way they are. I don't want to spend taxpayer dollars on folks who don't want help. So that's where we got to get. We're in the middle.
And no, Jeff, I'm closer to you. I mean, panhandling and homelessness are two different things.
Of course they are, but they are related.
Well, a panhandler is panhandling. A homeless person is there because they're homeless because of need, and so you have to decipher the two, and it's hard. And you're right. I mean, we'd be millionaires if you could solve that problem. But I mean, we have to begin to do something in incremental steps, like you said, to figure out the money. But I mean, I think when you say the city has done whatever they've done, I think we ought to look at what's worked, what's not worked. And as you said, we're not going to follow the path just because of distribution of funds because someone else has done it. Let's do things that work.
Well, since we're talking, and we apologize for the, it's obviously sometimes up here. This is the only time we can talk about things that we could potentially vote on, so this is the great opportunity for these workshops. So philosophically, Lumen, I mean, I'd like to do something where we spend this money to make the greatest impact and transition people who want to be out of homelessness and into being productive citizens, homeowners, renters, workers, whatever the case might be. But I want to do it in such a way that it's sustainable. This is one-time money.
Absolutely.
So, perhaps we could look at, we were going to get the SAFER grant. The SAFER grant, they give you a lot of money up front, the next year a little bit less, next year a little bit less.
Sorry, we were or we are?
No, we're not doing that anymore.
What?
SAFER grant's not happening, it's dead.
When did
Because
we
it would have
When did we decide that?
I don't know, I think the decision was made.
Who made the
Who
decision?
made the decision? Because that's not the decision we
I
made
didn't
as a
vote on it.
board.
Well, we're not talking about that.
Well, you brought it up.
Yeah.
And the funny thing is that
Wes,
I heard
you
it,
wanna
we
weigh in on
weren't
that?
going after it, and I wanted to know who made that decision.
Well, it wasn't me, but I'm happy with it. Wes, you
There
want?
was some quite a bit of discussion regarding the SAFER grant. I think as it related to the MSBU. I think in the end, when we moved $6 million over out of the general fund to help fund fire, that was the number we were looking at. And so I think that number leaves us open to apply for the SAFER grant, depending on how we move forward.
All right,
I mean,
I
what
hope
would be the
we're
reason-
going after it. I mean, it's money that's coming back to our community to help us get new firefighters. that-
I think part of the issue was, Robert, when it was presented to us the first time around, of course, are we allowed to talk about this? This isn't on the agenda, but I guess we're talking about it. So it was going to be, 100%, 75%, 75%. And then we got the real number back, and it was a 3-year deal, and it was 66%, 50, then 25. I mean, it was some ridiculous small amount, but it puts us on the hook for a gigantic payroll with like 40 additional.
Yeah, but it's firefighters that we need that we're planning on moving forward anyway. I mean, we can talk about this another time, but.
Yeah, I think it- well, obviously
I
since-
mean, you just
But
made the
this is
comment
not
that we weren't
homelessness.
doing it, so I just
this is
wanted to
not
know who made
homelessness.
that decision,
It's
because
not-
that's not what I'm hearing from fire.
Okay, well, that's kind of what I heard, but maybe we're hearing different things. Is Eric here? Someone here from Public Safety?
I mean, it's not on the agenda, so he's probably not here, but.
Yeah, okay.
But we're mixing homelessness and fire.
Yeah.
I mean,
We'll
that's
put that
a
on
whole
the- we'll put that on for
I mean,
discussion.
I am concerned that there are homeless grants opportunities that we've not applied for.
Yeah, and
so-
we're going to talk about that.
Yeah,
Liz has
okay,
got the
yeah,
information
yeah,
right here.
yeah, that's-
But getting back to homelessness, Robert, didn't mean to get you riled up.
Sorry, no, I was, heard about it earlier this week. We weren't doing that. I didn't know who
I thought
made
you
that
just
decision.
heard about it just now. You heard about it earlier this week?
Yeah, I've never seen Robert get riled
From
up.
fire saying that it had been decided we weren't doing it, and I
Okay.
just wanted to know.
I thought you just found out about it just now.
Well, you just said it, so that's the first time I heard it publicly.
Okay.
And,
all right.
and honestly, Jeff, I just didn't know where SAFER grant came with homeless grants. I mean, I didn't know why. That
Well,
said.
I was making a comparison.
Oh, you're making a comparison.
I was making a comparison. The SAFER grant gives you, well, the old SAFER grant gave you a lot of money, then a little bit less, then a little bit less. The new SAFER grant gives you a little bit of money, less, and then you fall off a cliff in 3 years. That's part of the decision. What I'd like to do with this $4 million is do something that's sustainable using that model. You set it up, you fund it, then with the expectation that we hand it off to a community partner so that it's sustainable. Because we obviously are not going to get this one-time money, just like the SAFER grant's one-time money for all intents and purposes. So philosophically, that's kind of what I'm looking at. Robert, what's your thoughts on homelessness, getting off the SAFER grant?
Yeah, so I think there's, I think we've focused on pockets of it in some of the comments so far is you're talking about people on the street, which I think, saying that they're not from Escambia County or whatever. So I think we do need to have shelters available. I think that with the one-time money, we need to try to help set up a facility that again, as you said, we can turn over to somebody, let them manage it, and that's sustainable, move it forward. Of course, it's getting those people services on the dashboard we were talking about earlier. I mean, I know in talking with PPD downtown, they know where to take people if they need to take them to Vinnie. I mean, it's building relationships with these people that if they continue to ask, and eventually one day they'll say, yes, please give me that ride there. And and actually I'd love to hear from Vinnie at some point and how that's working out, because they're getting they're getting people off the streets and into a shelter. And we need to make sure we can provide services, either mental health services, addiction services, helping them get income streams or a job, if they need to set up their welfare or whatever. But then there's the other side, and I think that's trying to prevent homelessness. And one of the things I've read about is the early interventions. So, looking at the data and seeing where we can help people so they avoid going into that. I think that's just as important as the people that are on the street. Because if you don't tackle both, then then it's just a recurring cycle.
Yeah,
I mean, it's just, you get one out the door and one comes in.
Yeah.
So, again, I think the dashboard's good. I guess maybe a deputy or a police officer that doesn't have as much experience on where to take people could use it. I think it's more for the public to use, but, if it's late at night and they're trying to help somebody, which they do that. Like I said, I know PPD does it downtown all the time. Then they have that right at their fingertips, and it's expedited service for them to choose that. But I wouldn't say that it's just for law enforcement to use. I think it's, for any homeless advocate that's out there that's making contact with someone that wants to show them, or the person that's looking for help independently can go to this and see where they can go.
Let me ask you about substance abuse. Some shelters say you have to enter and you have to be clean to enter. Some don't require that, but you can't have the drugs physically on you. I'm just going to put this out there philosophically. I don't want to spend taxpayer money on enabling or condoning that lifestyle. I want to help people that want to kick drugs, but I don't want to say, well, you can't have your drugs physically on you, but you can come to our shelter, and essentially what you're doing is enabling them to do it the next day, get up, go do crack or whatever they do, and then come back. So philosophically, that's where I'm at, but I'd like to know where the board is, because maybe we don't agree, and that's fine.
I would say, I guess what we've heard in some of our panhandling ordinances is that you need to have that come as you are shelter in order to be able to enforce something. That way they can take anybody there. I think as someone, if they keep going there, hopefully you're making contact with them enough, or just that once evening, once in the morning, that you can try to help them turn. It's also, it's not just a shelter for someone who comes in on drugs or something like that. I would say the majority of it would be for the people that do want the help, and there may be the occasional, or I don't know the exact numbers on what that would be, but
Sure.
I think to say that you don't do something because some people may show up on that isn't. I think the idea is that we want to create a center that can accept them, but the overall mission is to help everyone find help and get off the streets if they want to, and be a productive citizen of society.
Okay, well, that's a reasonable point of view. Lumen, your light's on.
Thank you, Mr. Chairman. The definition of insanity is doing the same thing, expecting different results. A temporary shelter has never stopped anyone from being homeless.
Right.
And so we got to look at our service gap analysis and see where the need is. And so, I'm interested in spending the money, Jeff, even if it's $4 million or $8 million, if we got to take other ARPA funds. But I think it's very important that we take our staff, our human services staff, we take our healthcare staff, we take our homeless coalition to take those ideas to come with something that's sustainable. We know this, if we're going to put one-time money, it's really just capital money, really what it is. But we got to go into interlocals with people that are going to provide the services. And so if we don't have,
Correct.
if no matter what we do, if we're not doing mental health counseling, if we're not doing drug addiction and alcohol addiction counseling, you give them temporarily, you put them in a shelter for, I don't care, 3 days, 10 days, 30 days. The result is he's going to end up being homeless if we don't give them the tools to be sustainable. And so rather than create this long chain of thinking that we're going to solve homelessness, I think we create a small chain to create a model that we make sure that we get them from soup to nuts, that we make sure we get them all the help they need, we get them in housing, and we make them economically sustainable. That's the only way to do it. You just take, it's one person at a time. We take one homeless person at a time, and it may be expensive, but we got to create a program that does that in collaboration, because we can't do it as a government. We have to do it in partnership with somebody.
Sure. Now, and I'm all for that. Now,
And we got to know the service gap analysis. What is the real need? Homelessness is just too broad to say we just got a homeless problem.
Yeah, it is.
Where are the gaps? Where are the unmet needs? And that's our intervention here is, there's millions of dollars that have been raised right here in this game. Millions of dollars have come into Escambia County for homelessness.
yes, they have.
What's been the results of the millions of dollars that have been placed on the ground in Escambia County? So before I make another decision, I have to know exactly what did you do with the money that you got? What was successful and what was not successful?
Sure.
I think that's very important.
And I think we're still trying to ascertain a lot.
And I know we are.
Let me
and we're
ask
not
you-
going to solve it. I'm sorry. And I say that just as you said, we have this conversation, but there are experts. There are people that do it. We have a staff. So I'm interested in having this conversation to come up with a kind of a global direction. But the actual ingredients, we need to hear from staff and experts of where we need to be with it.
Sure. Let me ask you this, though, philosophically, because I heard from Robert. I really would like No, and I'd like to hear your thoughts, Lumen, though, on the folks who are unrepentant in terms of their want to continue to do drugs and stuff, but they want help, they want shelter, they want food, a hot meal, but they're going to not, they don't want any kind of rehabilitation. They want to continue. So what is your thoughts on that? Because to expend taxpayer money, I mean, I want to help people that truly need help and want help, but if they're in where they are and want to continue doing drugs, dysfunctional, self-destructive stuff, what's your thoughts on that? How do we tackle that challenge?
It's simple. You got to help someone who wants to help himself. I mean, we're not. I mean, biblically, I mean, we won't save the world.
Sure.
So I mean, but we have to give people an opportunity, and it's your choice. You know, once we give you that opportunity. But when you say that, for me, Jeff, fundamentally, when we say, well, it's people that don't want to help themselves, I say to you, okay, tell me the mental health services that are provided here in Escambia County.
Sure.
Tell me the drug rehab, adult alcohol rehab programs that we have. You know, I mean, so quite frankly, I mean, I'll tell you that someone wants to welcome to me, not very many. So, I mean, I can't just, you know, cast judgment that most people don't want help. I agree with you. A lot of people want to be panhandlers. A lot of people, but I don't know if I'm not providing that service. If we provide the service and they don't take advantage of it, then that's just on them.
Sure.
But we have to take the resources that we have to put those services in place.
Yes, absolutely. Stephen, your light's on. We haven't heard from you yet.
Yeah, so, all right, I mean, the city has spent most of the money that they allocated towards this. And it seemed like, I mean, they did that, you know, relatively quickly. And, you know, I'm sure with, you know, with the best of intent to, you know, take the money that came in to try to get, you know, to try to receive a benefit, you know, benefit on the ground as quickly as possible. Do we have any idea about the effectiveness of what they've done or are doing? I mean,
Well,
they
that
might
was
be
part
a
of
year into doing some of their stuff, right?
that was part of the reason why I thought a joint workshop would be helpful, because they could present the data and then we could take what was working perhaps and run with it. But no, I don't know if they have that yet. I thought maybe that would be something would come from a
I'd love to
joint-
see it because I tell you, in the eyes of the average citizens, homelessness has gotten worse, not better.
Yeah, and I've heard that as well. Stephen, you were saying?
I mean, Lumen, what did you say?
I said, in the eyes of the average citizen, it's gotten worse, not better. So I'd love to see that data.
Okay, just, you know, and I'm.
And I don't know if that's real. I don't
Yeah.
have the as you said, I don't have the empirical data to help me to make an educated decision of what's worked and not worked. I mean, I see John's here, and they meet, they have a continuum of care task force. I'd like to hear what's worked and what's not worked. I mean, that's what I'd like to hear, Steve.
Yeah, it's something that, you know, that I've talked about a number of times over the years where it's, you know, I mean, it's, at least based on, you know, I'll say our combined experience over a number of years, you know, Lumen, it's difficult for us to, you know, crack these programs from scratch and say, you know, we're gonna implement something that we know is gonna be successful with X amount of money, you know, and
Right.
that's, you know, seems difficult. So, you know, that's why I was just kind of curious. It seemed like I said, they got their, you know, they allocated money pretty quickly. How was that going? Did that seem to be helping some? You know, I'm not going to be the person that's got a dozen ideas about how to, you know, about how to address this. I mean, you know, and it's a completely unrelated topic, but you know, I did hear a little bit of your Children's Trust discussion from the other day about the process of, you know, the process of how are you going to actually allocate, you know, money? You know, how do you do that? And you know, I think it might have been mentioned that impact here, you know, Impact 100 it's again not directly related, but just the premise of you have money and you know, you have money and you have a board and you're trying to have a real impact in the community. I think that there are, you know, I want to say Impact probably has 20 years now, give or take. It's got to be
Something
close
like
to
that,
that. And you can still see the residual impact of some of those, you know, original grants from Impact, you know, 10, 12, 15 years ago. You can see some of that impact still. And maybe, I don't know. Again, I think it might have gotten brought up at the Children's Trust the other day, but you know, maybe it wouldn't be the worst thing in the world to identify some targeted areas that we would like to try to impact and say, you know, well, you know, if just, okay, so one of the things I know that Travis and Donna, a few of those people that are here for, related to the family, the family aspect of homelessness, or the, the veterans aspect of homelessness, or the, and I don't know that, just based on seeing, some media over the years, we talk about drug addiction a lot, but some of the saddest cases that you see are the ones that are related to alcohol addiction.
Absolutely.
I mean, apparently, daily or very, regular heavy alcohol use, at some point in time, your body almost hits a point where when you stop, it doesn't even matter. I mean, you can't stop. Your body needs it to function, and you've done so much damage to your body that to stop, years later, doesn't have much of an impact. So, maybe we try to carve out buckets and say, towards substance issues, whether it's opioid or non, substance issues or alcohol issues or, family homelessness issues or veterans or, single mothers. I mean, that's got to be that has to be a part of the, I would presume that some of what's out, what's out there. Mental illness is
Huge.
I would presume, a huge factor in it.
Yep.
Just like it is in our jail. The numbers, it has to be, as a layperson, it would seem like the majority of the real homeless are in some way mentally ill in some fashion.
So Stephen, can I ask you something?
Yeah.
Because in hearing what you're saying, I tend to like what you're saying, because what I'm hearing you say is you would like to give grants out to existing people that are doing things based upon some criteria we would set. Alcohol addiction, drug addiction, but let them come and apply for the money?
Yeah, maybe treat it that way. Let them put
down
the
an
work.
RFP.
Let them put the work into the ideas and the efforts.
But then how
And-
does it become sustainable once we give them a one-time
Well,
infusion?
I think maybe that's where just by the makeup of our genders, none of us have been on the impact board, but our county attorney has been. I don't know. Are you still a member of
Did you
Impact?
pay your dues
Okay,
this
but-
time?
And you were on the board for a period of time, or no?
No, I was not on
Oh,
the
just
board. I
a
was on
member,
some
okay.
committees, but not
Okay.
on the board.
So I know
Steve,
sustainability.
do you mind? Steve, do you
That's a
mind if I-
factor in the way they
Sustainability
do
is a factor.
evaluation.
Yeah, but Steve, do you mind if I interject just a little
Yeah.
to respond? To me, that's a part of when you put out the RFP, RFQ, whatever, is that they got to prove the sustainability for 3 years, 5 years. I mean, what's your external funding other than, we're putting this funding in. How are you going to sustain this? Through private dollars, through other grant dollars? But I think we put it out. I mean, because as I said earlier, all of us are going to have focus. My focus is juvenile homelessness. I mean, because I say if I can get a child off of being homeless, I mean, that's a long life,
Yep.
versus me working with a senior, not that I'm not sympathetic. So I think that, we have to kind of set the mission or the vision, and then let the experts respond to trying to fit into that mission. I mean, with the details, and I agree with you, how does it become sustainable? Well, they have to tell us how it's going to be sustainable. We're not going to give you money, and you say that you can't maintain this program for the next 2 or 3 years, or you're looking for reoccurring funding, because it's not reoccurring
not
funding.
reoccurring,
I mean, as Stephen said, you need to go to Impact, you need to go to other places. I mean, we have a very generous philanthropy community.
Yes, we do.
That private dollars have always sustained, and public dollars will never sustain. But we can give a push.
Let
And
me
I don't
ask you
know, if
this.
y'all, have y'all been on the other side, like the applicant side of Impact? I know
I have,
you had. Okay.
multiple times.
Okay, so
Allison didn't vote for me, we didn't win.
she did, well.
Trouble.
So, I've been on a few boards that made applications, but one time specifically, just because I was treasurer of that board, I had to do
The presentation.
the majority of, I didn't do the presentation because I'm not, Miracle League was successful. But they were successful because of the programming was very legitimate. But the appeal often at that, when you get to the final presentation, is from the story and the emotional part of it. And the emotional pitch is not my strong suit, really. I mean, but I did a tremendous amount of the financial work to make the application, and then I had to do, in subsequent years, had to do a lot of the
Reporting.
work to show where the money was spent, how it was spent, invoicing they had to approve. I mean, there's a lot of that there. I don't know that there's not quite a bit of, or at least some of that process that we couldn't maybe duplicate. And again, and I think it was brought up at your Children's Trust meeting the other day. But I don't know that some of, and I mean, I know it's not advertising, we can talk about whatever we want, from my point of view, we can talk about whatever we want out here. So, I mean, it's, it's recorded. But, and when you look at children's trust issues, you talk about what, be pretty easy to honeycomb different issues there and say, look, a lot of, people are going to put work into, whether we set, Impact has a pretty solid number of what they're going to, it's going to be 100 and something thousand, between 100 and 130,000 or
Right.
something. Historically is what it's been. I don't know I don't know we have to duplicate that because we can, I think we would want to, perhaps consider larger programs if, just based on the legitimacy, not necessarily put a cap on it. But still, I think maybe this would be a way that we could go, that we could have some of these dollars that we expend have life in 10 and 15 years, which is what I know all of us want.
And I think the beauty of that idea is each of us probably have our own thoughts on what would be successful or what we'd like to see. If we take that 4.1 million as the seed money, and Lumen brings forward a proposal about, youth homelessness, you bring forward a proposal about, something, Robert brings one. I happen to think Satoshi Forest is a model that needs to be scaled up because it works. On a shoestring budget, accountability, he puts people to work, and they transition in and they transition out, and it's been proven. If we're going to do it that way, I'm going to bring a Satoshi model on steroids, and I would hope I would get support. But I will also be supportive of other things. What I like about what Stephen just said is we can each take different angles, different attacks based upon what we think we ought to do based upon expert input, and we can see which one works. And we could do a lot of different things at once. I'm fine with that. I think that's not a bad idea. Robert, what do you think of that idea?
I mean, I appreciate it, but I think if, you're not moving forward together, I mean, you're moving in 5 different directions. And,
Well, each of those would require a vote of this board.
no, I understand that, but I mean, it's,
I mean, the board, hypothetically, the board would set the kind of the barrels of
well,
what
and
we
I'm
would
just
be
saying,
looking
I
at.
think it just shows how vast this topic is. I mean, there's veterans, there's children, and I think, we would all support that, but we also have somewhat limited funds, and I think if you try to do too many things, do a little with a lot. Sorry, you do a little bit for a lot of things, you're not going to have as much of an impact by trying to focus on some things. And,
But Robert, think about this. I mean, honestly, the $4 million is just a drop in the bucket. I mean, if we collaboratively work together with a long-term strategic plan, with our partners, obviously giving input, but I mean, as Stephen often say, I'm big enough to stand here and make a decision. If it fails, it fails. If it succeeds, it succeeds. But I mean, you think about the opioid money we have right now. When we're talking, I mean, we don't even, we just allocated money over to CDAC. I mean, so I mean, we're going to have $8 million that we got in opioids, so we should be doing that. I mean, if we're looking at funding, healthcare and healthcare initiatives for mental health, I mean, there are ways that we're funding it, but I think that we failed to leverage it, in my opinion. And so, to me, the $4 million is, I mean, it's really just a drop in the bucket of really what we need. But we're not going to solve all of homelessness. You know what I mean?
Right.
A lot of people have gotten rich off of, I mean, I call them poverty pimps. That's what they are. I mean, off the backs of the people. And so, we have to put something that we're going to say we're going to have a targeted audience, something small change, and let's win. And once you get a win, then you get another win.
Right.
But if we go, I'm agreeing with you. But if we go trying to tackle the whole bear, I mean, the bear's going to eat us up.
Yep. No, I like that. I like that.
And then, hey, Joe, I mean, just, of course, going through all the articles that Liz sent the board, there is some, just going back to what you'd asked earlier, about what if it's somebody who shows up with a drug addiction or is on high, I mean, I think they're showing that providing housing first and giving them that structure, I'm not saying giving them a house, but giving them a place to stay helps that STEP program, and
But we have to be strict, though, Robert.
I understand that, but to say that that we're not going to do something because some people might come in that are high or something like that. I mean, right now, we don't have, we have a couple organizations, but I think to not move a project forward because of the possibility that some who are high on something or on drugs might also use it isn't the, I think we need to focus on moving forward.
No,
and then
and
work
maybe
through that later.
maybe you're misunderstanding me. If you're high on drugs and you want to get off, I want to help. What I don't want to do is say, you know, you can't bring drugs here, but we're going to wink and nod, and we know you're going to go out and get high tomorrow, and you can come back high tomorrow, and you're going to go, and you're not with the program. Not for my money, not for taxpayers' money, for the people I represent.
And I think
But-
that's what the Waterfront Rescue Mission does.
Exactly.
And I think some would also say that's not where people can get help then. You know, I mean, I think, and I understand it's, hey, you're gonna use our program, you gotta play by our rules.
Absolutely.
But I think you have to get people there. They're not just going to come, and in that case, then you're just still perpetuating it. But I just didn't want to not do something because somebody might show up.
Yeah.
on
No, if they show up high and they want help, I want to help them. But I guess there has to be a policy. They can't just do it every day, and I'm going to be there like a schmuck.
Yeah,
Doug's
yeah,
been
exactly.
waiting patiently, Doug.
Yeah, but you're not going to kick your kids out of the house because they come home drunk. I mean,
Yeah,
you know,
of course I
yeah,
wouldn't do
yeah,
that.
Completely not the same thing. So, actually,
Completely
so-
could be.
It's important that we separate the idea of come as you are from stay as you are, right? And I think, Jeff, that's what your point was. And so, your come as you are location needs to be something that we can, that's actually kind of that's a crisis environment, right? And then once somebody has passed that initial crisis, it's not like they go to work and become home to the next day,
They need
right?
the help.
They need to be able to transition into an area, that's safer for kids, where they can start to build a resume, build, work skills and those kind of things. So those are actually two very completely separate aspects, two different facilities that aren't co-located.
Right.
The come as you are location is very public. The other areas where where you're transitioning toward home life need to be much more private. Because you have oftentimes the violent spouse or the former pimp or whatever,
Right.
that would not, it would not be beneficial for those areas to be known publicly, right?
Right.
We're looking at a fairly small amount of money, and certainly we've been having this discussion. I've been having it now for almost 8 years. My peers here to the right for over a decade, and we're really not changing anything. We
Right.
continue to do so, do more or less the same thing. I would hope that we don't need to do another gap analysis. I would
No.
hope that we don't need to do another, another roundtable of all the important people and all that kind of thing. What we should be thinking of, though, is what can we do with a small amount of money, and even if we have to put a little bit of local dollars with the $4 million, and creating that place where the deputies would be able to take somebody who is in crisis out on the streets, get them off of the street. That starts the ingestion process. And it also starts the weaning out process for those that we've identified, we were talking about, that don't want to see change.
Right.
It's noteworthy, you asked the question point blank, what about those who don't want to change? And didn't really get much of an answer about that other than an agreement that, yes, we should not be spending taxpayer dollars on that. Commissioner Bender also brought up that as well, that, that we're going to have that population of people who don't want to change. There are a couple aspects of it that we really need to address, which is what do we do with that guy, the one that does not want to change?
Yeah.
And also, how do we empower our primary public defenders, the defenders of the peace, the deputies, to be able to pick people up and take them to these locations where they can get help. There is nothing beneficial about allowing somebody to stay on the street
No,
in any
I agree.
condition.
I agree.
No matter what we do, it has to empower people to come off of the street, and feeding them on the street or enabling them to continue street life is absolutely not helping our community, and it certainly is not helping that homeless person.
No, I appreciate that. Well, gentlemen, we're almost up against time, and I'm going to keep this moving forward. There's a lot of meat on the bone. I would say from this discussion, I don't think there's really a clear consensus, other than what I would say is I think the idea of perhaps having a standard form for folks that have a proven track record, have a existing 501c3, and have a record of success, and something that that we support, you know, I would be amenable, because I think that's what Stephen said. I think I'd be amenable to looking at, you know, a grant from that 4 million I mean, you know, with the strings attached that you have to keep this going in perpetuity, not unlike a impact grant. And I don't have a problem with going a lot of different directions, because I think, I mean, you look at a sick patient, sometimes it's not just one drug, it's multiple drugs, multiple angles to cure the patient. And this is such a complex issue that I think it does require multiple pronged support. What I don't support for the money, maybe we should make that a quick lightning round. What I don't support is one-time quick fixes to make problems go away. Giving someone a hotel voucher with no expectation, I think, is a disaster. You're going to wreck the hotel rooms, and it's not going to pay. I think that's a dumb idea. If I could just be very blunt about it, I wouldn't vote for one nickel of that. It has to be something sustainable, something to help someone with the direction that we're looking for people that really want help. Families, I want to do what we can for families. My understanding, there's not a whole lot of shelters for folks that are families. Whatever we can do on that. So,
Jeff, my colleague said something, and you nodded in agreement, which is rare. But he said that there was a gap analysis already done. By who? Who performed that?
No, I said that we don't need to do another one. I said
Well,
we've got an enormous amount. I mean,
But where's the one
on
that
the one
we
hand,
did?
you're telling us that you wouldn't want to do and have another consultant come in. You wouldn't want to go in and you know, analyze this all again. And on
I
the
said I
other
don't want
hand,
to do
you're
another
saying,
homeless
let's analyze
study.
it again.
I'm not interested in doing a homeless study.
That
I
4
said, but we
million
have
needs to go to something tangible.
Right. So we have to know what's tangible. You know, so let me, we sat here and all talk because this is what's in the media. The reality of it, who's talked about homeless prevention? Who's talked about children? The indicators will predict. A person who doesn't graduate high school, who gets on drugs, who's not reading at 3, will probably be homeless. So, it's great to, have these great conversations of building a wall around Escambia County, but we need to put money into prevention. And so I'm not saying it's not an
No, I want to.
analysis. But I would need to know if it's been done.
well, how about this as a takeaway? Since we're not, I think there's some broad agreement. I think there's some areas where we agree. I think there's certainly some areas where we disagree. But how about this? We tell staff we've got 4.1 million. Liz is sitting here with 2 stacks. There's potentially almost $3 billion worth of grants. We start out with the 4 million. We get things rolling. We tell staff, come back with a standardized request form for entities that have a proven track record in this space, and then we vote on them. And we give them money. And we can go at the same time and apply for this additional money, and then maybe it doesn't become just simply a one-time injection. But there's a lot of money, and Liz tells me before the meeting that we are eligible for this money. Liz, do you want to?
And Jeff, that's part of my problem. If we are eligible for this money, if this is a crisis, if it's so important to everyone, why hadn't we applied for it?
Well,
if it's a priority, why
I
didn't we apply?
didn't know about it until last week when I heard about it. But the good news is, I think we have until October. Is that correct? So we can get in the game. And another thing to say is, well, we probably should have, but the bottom line is we're sitting on 4 million. We haven't done anything with that yet. So we do something with that. We apply for this. But
Well, I agree. Let's spend it today.
well, the problem is
I'm ready.
The problem is we don't have the method yet to disperse the funds. But would you guys
Exactly.
be okay with staff coming back with a recommendation on a process for these entities to request money? And that way, Robert, like you said, we're going to speak with one voice because we're going to vote on each thing that comes forward.
Jeff, I got
Each
one
thing.
question. I see Walter from Community Health. Walter, do you mind? I know this is a workshop. I just got to ask one question about
Yeah,
data.
please, call him forward.
Walter, can you come for a second? And Walter, thank you for your work for homeless. Quickly, you sent me something not long ago about data on homelessness. What is that data?
So in 2021, we ran a data set, myself and some other social workers. We took a survey at the I-110 encampment, then also at the Alfred Washburn Center, so county, city. We reran this data set here in, actually this last month in July. The only difference, it was the same exact survey, except we only ran it at the Alfred Washburn Center because the I-110 encampment was no more. We did include one additional question to ask, were you a previous resident of the I-110 encampment? Came back around 33% of those surveyed. This was a big enough sample that it's representative, so we could put it plus or minus about 3.5% margin of error, I believe with a 95% I'm getting into statistics here, but it's a big enough sample to where it's representative of the population as a whole. Some of the things that we did see is we saw a jump of about 9% in access to healthcare. So that's pre-interventions from community health and other community partners versus post-intervention. We're seeing a jump in unhoused women. We're seeing a jump in unhoused LGBTQIA. Kudos to the Sheriff's Department. Some of the questions we asked were negative police interactions and number of police interactions. We saw a decrease in those interactions between the Sheriff's Department, especially with the Sheriff's Department. We saw a very drastic decrease, as well as with PPD saw that drop as well.
So Walter, I wouldn't cut you off. I mean, because I know it's a workshop, and I'm sure my other colleagues have, questions. But I appreciate the work of community health, because certainly if a person's not healthy physically or mentally, I mean, nothing else works. But you're on the task force. I mean, if there are two things right now that you think that we could do as a board to move this forward, what would those two things be? Like in 30 seconds.
We need to know where the gaps are. So, and that's, looking at the dashboard, you talk about family shelter. We do not have a shelter. If you have a family that has a male over the age of 13, whether it be male led by an adult or a child, where's that shelter at right now? The other thing
So we don't know where those gaps are, correct?
Well, the data's out there. I haven't seen the gap analysis that has that all in one spot. The other thing is we're having to send people to Panama City for detox right now. So when we have those sobriety contingent shelters, we have individuals that, you can potentially die coming off of alcohol or opiates. We have to send them all the way to Panama City and then bring them back because we don't have that detox right now in this area.
Yeah, Lakeview got rid of, what did Lakeview get rid of, Walter?
ASU.
ASU. And that was servicing what need?
So that is a Baker Act receiving facility as well as the designated detox facility. So when you think of Baptist or West Florida, those are not detox facilities. So in order to get somebody into those facilities for detox, they have to meet mental health criteria for Baker Act. So if you've just got the true blue alcoholic or somebody who's just addicted to opiates or amphetamines or whatever, and they don't have the accompanying mental health issues, you can't get them in. And so we don't have that anymore in this area.
Thanks, Mr. Chairman. Walter, I appreciate it.
I have a question.
I see Ms. Smiley back there. I appreciate what y'all are doing. Thanks.
Thank you.
Oh, wait, he had a question for you.
Yeah, Mr. Arrington, is that data set that you were just referring to, has that been made available to the Board of County Commissioners?
I can absolutely email that out to all the members of the BOCC. Just a plug, it was collected from some students from UWF when I was still working on my BSW, and then the 2022 data set has been collected in partnership between AHEC, who is a national organization for healthcare for underserved communities and community health of Northwest Florida.
Yeah, I would very much like to see that. It's interesting that you note that among the homeless population, they are reporting a decreased interaction with our sheriff's deputies. And I know that, Jeff, my office is equally seeing this uptick in comments and calls from the constituents that the homeless activity and it's in a negative interaction on the citizen is actually going up. So while it certainly is better for the homeless person to have fewer interactions with the sheriff's deputies, what you're also seeing is that that may well be a part of the cause of why our constituents are finding themselves more and more victimized by some of the conduct of the homeless. So interesting data point. But Mr. Arrington, I very much would like to see that data set in its completion, in its entirety. So if you could please send that to our offices,
Absolutely.
that'd be great.
And what I would say to that is what we're seeing in the homeless population locally is we're seeing a spillover. So your traditional encampments on Beggs Lane, the clay pits, the other areas, they are at this saturation point. So now they're spilling into the communities. So it's more visible to the community. We have deputies like Deputy Tinch, who has great relationships with the unhoused. I know a number of months ago I had a meeting with Sheriff Simmons, Hobbs, and some other people actually down at Beggs Lane. And we walked through and we gave parameters to that population and said, look, here's the box you need to stay in. And so that's why I think there has been that outreach from the Sheriff's Department. But I think what you're seeing and what the community is seeing is you're seeing that spillover. Additionally, we've had some pretty bad actors within the homeless population. And those of us, other homeless advocates, to include Mike Kimbrell, myself, have been able to pick up the phone, call the sheriff's office, and they've handled those situations effectively and removed those bad actors. And so again, I think it shows the partnerships that are starting to develop and working as a community from a holistic perspective to let's remove those bad actors, but let's also give these individuals a little bit of breathing room. But again, it's getting so out of hand that it's becoming so visible. I mean, I'm over on the west side and I'm watching encampments spring up on Navy and Gulf Beach. I'm watching, just all over the place right now, so.
Yes, and it's those encampments, as my District 3 counterpart has already said, that's where the crime is taking place. Preventing those pop-up encampments should be a priority of this board and well within the purview of
Where do they go?
the tools that we have.
We don't have anywhere to put them, though. That's the problem.
Well, again, that's a big part of it. There should be a place for somebody to go who's looking for to evolve out of that lifestyle. But at the same time, we have to make it very clear that Escambia County is not a place for those who wish to stay in that lifestyle or refuse to change. And I'm not going to get in a debate with you here, Walter. The reality is that we have to have the same level of respect and concern for the equities of the tax-paying citizen here as we do for the homeless people. We still, again, we cannot seem to address that issue about what about the folks who, given the opportunity to change, choose not to. And until we can include that into that conversation, we're having an incomplete conversation. Thanks.
Thanks, Walter, I appreciate
Looking
your
forward to
time.
seeing that data set. Thank you.
Thank you, Walter. And
Thank you.
Mr.
Brian,
Chairman,
quick
let
question.
me just make one
Walter.
comment.
Yes,
Walter, he wants you back. Well, before you say that, being homeless is not a crime. The behavior and the actions becomes the crime, not being homeless, and so I disagree with people, and all homeless people are not committing crimes. Go ahead, Robert.
So, sorry, Walter, I thought you said it was negative police interaction had declined. Is that, or did you say that police interaction as a whole had declined?
Police interaction as a whole had declined, as well as negative interaction, because we also, in the survey, and I'll send the survey tool itself with the data set so y'all can see what it looks like. We asked, was that interaction positive? Was that interaction negative? And so not only negative interactions declined, but interactions as a whole declined from that data set. I did see some shifts to the positive, that the interactions were positive. So, and again, and this is personal, this is not scientific in the tool, but my perception is a lot of that shift. When the tool was taken at the I-110 encampment, there was a heavy police presence down there, and so there was a lot of interaction. But specifically with Escambia County, that's where I saw the biggest shift, and that was broken down within the survey tool as well. And the data was it PPD, was it Escambia County, was it Gulf Breeze, was it Santa Rosa County Sheriff's Office, was it private security?
All right, I look forward to seeing the data.
Yeah. And thanks, Walter. I think, Mr. Chairman, it's probably going to be a bigger conversation with all of our partners. But I don't want it to go unnoticed, Robert. That because of politics and public opinion, we see homelessness as people who are in encampments. We see them that's sleeping on Palafox. But what about the grandmother who has 9 kids in Forest Creek that comes to
Sleeps in their
Evanwood
car.
every year? Oh yeah, and they're in a 2-bedroom with 11 people. She's homeless, and her kids have drugs. She has all the grandkids. There's a whole population that people don't see that's homeless and need help. And so when we begin to address this problem, we have to look at not just, what's sensationalized on cameras, because those are the people you see. The invisible homelessness is what's really existing in our community. And so you're right, Jeff, we're not going to help everybody, but we have to find a point of starting. Every journey starts with the first step.
Yep, it does.
And we narrow down who we're going to help and how we're going to help them. Let's go help. Let's get 10 people off homelessness and get them from a shelter to a permanent home with a job. And to me, we win. And so we're not going to solve 1,000 of them at one time. I'm not a big shelter guy. Honestly, because shelters are temporarily. I want to get them from shelter to permanent housing. that's how public housing was started. How Lyndon Johnson started it. Because of the Poor People's March. That's really how it all existed. And unfortunately, in America, we took temporary public housing and tried to make it permanent housing, which is another whole story of homelessness that has killed people. But we need to start, taking some. For me, when we bring this plan, we have to put some money into permanent housing for citizens.
And I think that's a perfect use for the money, and I look forward to that proposal being brought forward. But meanwhile, I'm gonna ask staff to bring some kind of a form or some kind of a process or protocol for us distributing that money, because I know there are things that are working, and I want to start spending money on things that work to start solving the problem. So unless there's big objections, I'm going to ask Wes to do that, okay? I got a thumbs up.
What do you, let's be clear, what do you?
I'm gonna ask-
for an
Yeah.
RFP? Well, I mean, what are we
Make a
asking?
comment on that when you.
Yeah. I'm going to ask him to bring the protocols and application form, not unlike what we do with our discretionary money, and it has to be an entity that's vetted, 501c3 licensed, and someone that's actually doing something that is making an impact so that I can bring that before this board for funding from that 4 million, and so that we can start attacking the issue. Because it sounds to me like we might not ever get to a point where we all agree on that one big thing we're going to spend 5 million on. That's fine. We can go, and I want to be supportive of your stuff, Robert. I want to be supportive of your stuff, Stephen and Lumen and Doug. But for my part, I might want to support something that you guys might not. It might not be your number one. But I'd like to start distributing the money that we're sitting on to start solving this problem, because I'm getting a lot of complaints from
So, in
constituents.
what direction of staff, I mean, what components do you want to see? You want to see a healthcare component? You want to see a mental health component?
No, what I want from them
components do you want in it?
is a form, a standard form or a protocol or a flow chart of how to bring something to the board for funding in this space. Homelessness, rehabilitation, youth homelessness, whichever way you want it, that we can access this money. And of course, it has to be fit within the legal uses of this money,
Right.
which I think is pretty broad.
Right.
And I've already told you guys, I've already tipped my hand. I want to scale up Satoshi Forest. Low cost, many years of proven success. And they get people off drugs, they get people in jobs, they get people in houses, and it's like 15 grand a year, and the guy's been doing it, but longer than a decade. I want to scale up that. That works. Get it away from subdivisions, get it away from housing, get it out away where it needs to be, and bring the services out to them. That's what I want to do.
I like that.
Jeff, just to be clear, and I want to make sure that we spend enough time on the last sentence that you just said, so that, Jim can actually catch it.
All right, is Jim here?
When you say scale up, well, he watches and then writes. When you say scale up Satoshi Forest, I believe that you do not mean continuing or a larger facility at that location. Is that correct?
No, just that model,
Yes.
scale the model.
Okay. And because the part that you just said there, away from subdivisions.
Correct. That's a little too
that's
close.
Actually, that's the one dark spot in the story of Satoshi
Yes.
Forest, is that it did not take into consideration enough the impact on that already
neighbors.
pressurized neighborhood. So, again, the impact of this problem on the taxpaying citizen, that is an important part. And I think that I can just see the headline.
Yeah.
Burgash wants to use taxpayer money to expand Satoshi Forest, right? Clearly not what you intended. But I've seen worse headlines based on similar information.
So have I, believe me. I've seen the cartoons too.
Oh, yeah, well, I mean, Jeff, here's the reality. We want to help people with tiny homes, just not in my neighborhood. I want to help people with habitat homes, but just not in my neighborhood. I want to help homeless people, but just not in my neighborhood. But the reality, some of this data tracking, the COC does this, correct? I mean, y'all have a homeless task force. Y'all have a continuum of care. And so, I mean, I say that, Mr. Chairman, to say that, there's been a lot of energy put forth. And so when we're saying bring forth forms, I would want staff talking to the COC. I mean, because even some of those grants that we have to go after, they have to be in collaboration with our continuum of care. And so I don't think we can go on an island by ourselves.
I think, if I might, we as the county can apply for those grants, correct? On our own. So yes, so we can, Lumen, and then we can parse them out.
Well, I'm very disappointed we haven't.
No,
I've said that.
Liz has done the homework. She's got 2.7 on the one? 2.7 billion.
I brought that to the last meeting.
Exactly.
Yeah.
She's done the work now
We do have to partnership with some of the community.
to spend it, to expend the money. But to apply for it?
We should be. Homelessness is a global universal problem. We have to collaborate.
Yeah. Oh, what I'm hearing is we're gonna collaborate in multiple channels in this space with multiple entities, and every single one of them is gonna come to this board for a vote. But we each have our own unique perspective on it, and I think there's more than one way to get from point A to point B. And I've got my ideas, Lumen, you
And
got
I like
yours.
exactly what
Let's
you're
bring
saying,
forward.
Jeff.
Let's
that we
start
got
spending money.
Yeah,
Let's start doing it.
I hear what you're saying. That you got $4 million. That's great. I got $4 million, but it's a $10 million project. So just go ahead and just start the project. I'll never finish the project. So it's always good to get as much money as we can possibly get to address it, because
Well,
I mean
we're
it's
gonna
every
do
end
both.
team.
We do both
Yeah.
at the same time. Walter, one final question for you. The ASU, you brought up something that's very interesting to me. So that's the Adult Stabilization Unit.
Correct.
Was over Baptist Hospital.
Lakeview.
Lakeview, on that-
Lakeview
on that
Baptist
little
in that
campus area.
facility.
very important because we have a raging drug problem in this community. I saw it for 10 years on the school board. It's worse than ever now. What in the world? I think that should be the headline. If you say people are watching, that should be the headline. I didn't know that. I know people that have gone through that program, and it's necessary when people are out of their mind on drugs or they lose it. So you're saying we're trucking people to Panama City now with all the big hospital complex we have in Pensacola? We don't have that anymore.
We don't have that, and what makes it even more complicated is how do you get somebody there? So
No, I don't care about that. You said something. I want to make sure that, because I'm going to get
Yeah.
on the phone with Allison Hill as soon as this meeting's over. I'm going to find out.
Panama City. So that's the
So
closest.
Pensacola has no ASU facility for stabilizing someone.
We
that's-
have no detox facility that serves the uninsured or underinsured population. There are
Whoa, wait a minute. Whoa. If everyone gets care, everyone gets care.
Nope. We have, so our substance abuse.
So, okay, I'm sorry, and I'm sorry to be this way, but I'm hearing things that don't line up with what I've heard from other people. So now that's when I start asking questions. If you are hallucinating on PCP in this town and they take you to Baptist Hospital, are you telling me there's not a place in Pensacola, they got to drive 5 counties over to Bay County, 4 counties over? Is that what you're telling me?
If you want detox services, that's correct.
But before, they did it right there over on the Baptist campus.
At the campus there.
Was that a part of their combining and selling of the?
I can't speak to that. I don't know the specifics. I know that I believe it was like 6 or 9 months time frame that ASU shut down from what I understand, it was because of staffing issues. But we have never been able to pull that back online. You put that in combination with the loss of WIFCA and
The loss of what?
WIFCA, West Florida Community Care, which is a long-term mental health treatment facility that was in Santa Rosa County. We've lost some beds.
Well, it worries me because there's a big drug problem in this community, and there are people that lose their minds all the time on these drugs, and they go to the emergency room. Do you have any metrics on how many people we're putting on buses, or I don't even know how you transport them in a straitjacket?
But Jeff, come on, can I say
That's
something
a
Walter,
big
before you
deal.
respond? Jeff, it's a huge deal, and we just got all this opioid money. We had over $8 million.
Let's get something here in Pensacola.
Exactly, and I'm very disappointed to hear that because we've been very gracious in transitioning with our partners at
Yes.
Lakeview and Baptist, and if they were going to exit with this huge opioid problem we have, I would say that, we probably would find funding. I mean, we have money for drug addiction off the opioid money. And so, I mean, that's crazy. I mean, look at the fentanyl. Look at the problem that we've had just in our EMS in our jail and drug overdose. I mean, we need that program. I mean, so.
I'm going to fact check this. I hope that you're telling the truth.
Well,
I
think-
I'm not calling you a liar.
No,
but-
Walker, he's pretty honest. His
Yeah.
boss is here. He's probably going to tell the truth.
But I mean, to me, that's just astonishing because we are the population center. I mean, nothing against Bay County. I've been there, great spring breaks, great condos, whatever. I don't know that they have the drug problem that we have. We've got a massive drug problem, big time.
But I'm with you. So you're saying they transfer them to Bay County?
So I had a conversation just last week with actually Melissa Johnson over with Village Communities and REAP, and we've got an individual that we're working with, and they need detox. So they presented to us at Community Health. We get the HIPAA releases, trying to get this young lady into care, and we've got to get her detox first. And so when we search online, and you can search SAMHSA's website, you can actually Google it, samhsa.gov, and you can say get help. So then it's the coordination with Melissa Johnson and REAP to see if we can get this patient to Panama City, because again, she's uninsured. So again, a lot of the individuals we're dealing with, they don't have Blue Cross Blue Shield, they don't have Aetna, they are uninsured. We are not a Florida Medicaid expanded state.
Right.
And so, the options that are available are few and far between.
But Walter, my understanding is these sorts of services are now covered 100% by any insurance that you would have. And to me, I mean, if they're covered 100% for insurance, I mean, Medicaid, we pay a fortune every year. This county pays a fortune, millions and millions of dollars for Medicaid. I mean, to provide services just like this in this county. So, if a person's high on PCP and out of their mind, what happens to them now if they go to Baptist Hospital?
We don't have a detox, and then we point to Medicaid, but if it's a single female with no children, she's not going to qualify for Medicaid. If it's a single male with no children, they're not going to qualify for Medicaid because we're not a Medicaid expanded state. And so we have these huge gaps in ability to get people insurance.
But that's the news of the day. If this is all true, I'm gonna look into it and research it because it's a problem if it's true. Because we need that service in this community a lot more than Panama City Beach Spring Break Capital does, in my opinion. But
Well, we'll let you take the lead on that.
I will. Robert, you had a question?
Yeah, I just gonna say, again, I think we all have our ideas on how we want to move forward, and of course, we all want to focus on a different area. Part of me wants to see if people would do an RFP. I don't want to put organizations through a lot of work if we're not going to follow through with it or put them through a lot of work. But I feel that our homeless advocates have really worked towards a cohesive and shared vision, and I think maybe by putting out applications and things like that, you make it competitive again where they're fighting for these dollars.
I like competition.
I'm not saying I don't like competition, but I'm just saying, they may be able to bring us something. I would want to keep that door open, that if almost like an unsolicited proposal or something like that, that if it comes to us that we need to consider it, I want to look at what's the best solution for the county and as a whole, and not try to piecemeal it like we've been doing, because that's what we've done. You look at our outside agencies. I love this, is that they'll apply for $50,000 and they're going to reduce homelessness by 25%. If that's all it took, right? And so, I think we can fund those things like we've been doing, but with the $4 million, we need to really look at what's going to make the lasting impression that this one-time money. I know we're going to go after all these grants. They're competitive grants. I guarantee you, we're not the only community that's facing this issue. We're not the only one that's going to be going after the grants. And so I think we need to make sure that we can accomplish something meaningful with the dollars that we have on hand right now. And
That's what we're going to do. That's what we're going to do. But we don't have to wait and let the perfect be the enemy of the good. There are good programs out there that are working right now, Robert. We're sitting on $4 million.
Yeah.
My office is getting complaints. I want to move forward. I'm going to have them bring an application form, and we'll put it to a vote. I won't bring anything that is not time-tested and proven. I've already pretty much told you the first thing I'm going to bring.
Yeah.
And it works. You have any issue with that?
no, I don't have any issue with
Okay.
that. And that's what I'm saying.
three.
But
We're going to bring an application form.
I'll add it. We can swap spit all day. And
We're
sit
not
here
gonna.
till
We're moving to
noon.
the next item.
Yeah, but I'm not gonna vote. You can just, however you want to do it. And Jeff, I like your idea, to vote for programming. $4 million
right.
is not a lot of money. Organizations are existing without us. Put that money into capital. Buy an old hotel on Cervantes and renovate it. And eliminate blight and help with homeless at the same time. Let's think out of the box when we do this year. That's all I'm saying. Let's just not do the traditional things.
Let's bring it forward, but
Let's go. I'm ready.
I'm ready
Bring it
too.
forward. You can bring it today and I'll vote.
So does that give you guidance? We need a standard form for folks that are in this space already with proven track records to make requests of funding. All right, good? All right. That was a good discussion. Thanks, Walter.
A little side note, I'm ready. I live down Bainbridge Avenue in District 2, and we can put Satoshi Forest Site 2 in my neighborhood. I'm all about it.
There you
So-
go.
Okay, but what about your neighbors? Yeah, I think we're going to be miles and miles out, but we'll have that conversation when we get there. All right, appreciate that. Great
You bring
conversation.
that on a standard form, Walter, and I'll vote for it. How about that?
So it sounds to me, guys, that based on this conversation, just to put a button on it, I don't think we need a meeting with the city. I think we've got a pretty good program. Does that sound about right?
Mr. Chairman, over the last 8 years, we've had a number of meetings with the city on this issue, and how it while it's one comprehensive issue, the city's solutions and the county solutions are oftentimes different, and they should be. I think that we have a lot more potential for actually creating a tangible result, just handling it ourselves.
Okay, good enough. So I will not pursue that joint meeting any further. Very good. Good discussion. Thank you. Okay, next up, Allison, you're recognized to go over the discussion of the county administrator's search.
Thank you, sir. Yes, so as the board is aware, you have last had a permanent contracted county administrator more than a year ago. So it's been more than a year. Mr. Moreno has been serving in the interim capacity. By previous board direction, the county did obtain an outside consulting firm, and they have now provided to you, it's in the backup, their final report asking for some guidance. Ms. McKee, who's the representative we've been dealing with at that consulting firm, has been asking now what direction we want to give her. Do we want to set up interviews? Do we want to pick a first tier, a first and second tier? What do we want to do with her work product and with the recruits that she's identified? And so I'm looking for some board direction to give back to her, and some direction from you on how you'd like to proceed.
Stephen and then Doug.
Thank you, Madam Attorney. And, Mr. Chairman, so basically that's the presentation. I mean, we have the backup. There's not anything further formal. All right, Allison, and, I want you to thank Ms. McKee. It seems like, a couple months ago, I was, a little concerned about the lack of depth of some of the, at least what I was hearing as far as numbers of applicants or, qualified applicants. And it sounds like they went, I don't know if they went back out or went deeper into where they were already, but it does seem like we got a large pool of qualified applicants, and some some with some local ties or at least regional ties, and but a number that are very number that seem very qualified from away. I'm certainly interested in what my colleagues have to say, but for my support, for my vote, I'd like to consider the work product to be complete and in good order and good fashion. I'm not necessarily interested in bringing folks to town for an interview. I've, to be candid, I think I've had a 13 or 14-month interview with the gentleman serving in the position now, and have been, extremely pleased and extremely happy with the performance, with the responsiveness to, responsiveness to our office, as well as I think the responsiveness to the board. One of the things that a number of us have mentioned over the years is, from the two employees that we have, some direct supervision over, or direct hiring authority over, the attorney and the administrator. That much like Madam Counsel, I think that Wes sees his number one job as implementing the direction from the board, implementing the strategies in the direction that the board has given, in in the best way that it can, while being cognizant of taxpayer resources and what's good for public service. And I think that's how Allison operates. And I'm sure in my conversations with her over the years, I've had some ideas. Some may have been pretty good ideas. Some may have not been very good ideas. But regardless, if the board wanted to move forward in a way, Allison has tried to find a way to help us do that. And I think that's what I've seen in Wes in this period of time, and what I'd be supportive of giving them giving the consultant a check mark for the work done, and no issues with the work product completed, but would be interested in asking Allison to negotiate a contract with Wes to bring back to us next week.
All right, thank you very much, Stephen. I would certainly want to have that discussion. Doug, you recognize that I'm going to weigh in.
Certainly a number of very qualified people on there. Some that I would have put on the Tier 1 instead of the Tier 2, and some that I would have put on the Tier 2 instead of the Tier 1. But I think that's probably, very commonplace. But clearly all, or many of them, highly qualified to take over the reins. When Wes took the job, he stood at that podium and made it very clear that he did not want to remain in this job, that he was doing what he was doing, taking this position for the good of his community, and did not want to remain in this position full-time, but was stepping up to shepherd us through a fairly difficult time of our community, which I do believe he has done that well. But just as what we refer to as Moses leadership, he who does the leading through that difficult time would then steps aside and allows the long-term solution to come into place. He bought us the time and space to do this search. Wes's service gave us the ability to do a nationwide search and get these candidates. I believe that we should, as a follow through with the strategy that we put in place, get a list of candidates, interview those candidates, and select the one most qualified for the position, and then bring that individual on as quickly as possible to allow for a transition from Wes to a full-time county administrator.
Thank you, Commissioner Underhill. When I received this list, I went through it very, very carefully, very meticulously, and importantly, a number of years back, we had a similar situation, and we had a firm, and at that particular time, we had over 100 highly qualified applicants. I mean, overqualified. In this bunch, there's some people, pretty good resumes, decent resumes. Cities, much smaller than our county. Counties, much smaller than our county. Assistant administrators in counties that are much smaller than this county. You even got a person that used to work at Waffle House that was sent as a name. You've got people who have their own company, whatever that is. You've got a lot of fluff in here, and we only got a total of 28 names. So I agree with you, Steve. Check the box, pay the consultant, and like you, I would be leaning much more heavily toward getting a contract with who we know. We know Wes Marino. He's been here more than 30 years. This last year, I don't want to use an expletive, so I won't, but he's kicked butt, right? That's not the word I'd normally say. He's got all our contracts closed, right? He's worked with us. When I call him, he picks up the phone. I know he does that for all of you as well. He's been at every single meeting every week to get us prepared. He's just a guy that we know. He loves this county, and I think he's doing a great job. And look, I'm not going to ever argue with success. So, Steve, if we put that on the agenda for next week, you're going to have my vote on that too. If Wes, I mean, I guess we're talking about you, and you're just sitting over here. If we put you on, are you up for the job? Do you want it?
Commissioner, Mr. Chairman, and Board, I appreciate the opportunity to speak this morning. And Commissioner Underhill is exactly right. He asked me a question, would I apply for the position, out of the interim? And I said I would not, and I have not. I have not applied for the position. I will say this, when you step into this role, you don't know what you don't know. And I believe the Board gave me an opportunity, maybe because I have been around so long, maybe because with being the Public Works Director, involved in a lot of different projects throughout the years, a lot of different facets of the county throughout the years, I believe has let me bring something to the table that maybe some outside folks couldn't bring. But, I stepped into the role in an extremely tumultuous time. Right away, our budget director resigned. The number 2 budget person had already left prior to that. So we were left with a budget office of 2 that had never operated at the level of the directorship. Our Office of Procurement was a train wreck, quite honestly. We were losing directors. We had many vacancies in our directorships and some of our managers below that. And in that time, I did the only thing I know to do, and that's just to show up and go to work. It's how I was brought up. You lace them up, strap the chin strap up, and get after it. And that's what we started doing. And I didn't do it by myself, I'll say that. I've had good people around me, and Debbie Bowers and Wesley Hall, Chips Kirschenfeld, and some of the leadership. And so I knew when I came in the week after, I knew we had the union issues going on. We had vacancies, massive vacancies, had low wages. And so I came into the role with an idea and a vision and a goal. Number 1, to wrap up our bargaining units. And so we started doing that. And you do that through clear communication. I'd said in previous negotiation sessions where this really was no communication. It was more an arguing session. And I didn't want to do that, so we didn't. And through that, and through some of our negotiating team, we were able to reach a consensus. I'm not saying we got everything we wanted, but that's how it is when you negotiate. And so through that methodology, we were able to wrap up nearly all, we still have one hanging out there, of the union contracts. And I believe it's good for the employees, it's good for leadership and the departments. It lets us know what our perimeters are and lets us know how to be successful. When the budget folks left, I'll be honest with you, I didn't know what to do. And then we had a meeting, and Stephen Hall showed up to speak for his neighborhood concern, and I texted Michael
The rest
Rhodes.
is history.
I did. I texted Michael Rhodes. I said, "Don't you let him leave before you get me his cell phone number." And and so, you know, through that, I called Stephen. I said, "Listen, man," I said, "I know you're at the city. I know. I don't even know if you're interested." I said, "But I'm asking you, can you help us out at least?" And so he thought about it. He said, "Yeah, I'd be happy to help y'all out." And we touched base with the mayor and some folks at the city to make sure everything was good, and it was. And Stephen started working nights and weekends, a lot of nights and weekends, to pull us through that initial budget process, and I will be forever grateful for that. And then I'll turn to purchasing. I got to tell you, if you're in this role, you got to have a good engineering department, and I've got the best county engineer around sitting right there. And you got to have a good budget office, you got to have a good HR office, and you got to have an office of procurement who can drive work out.
That's right.
The past 2 years, even before that, about the most procurements we've driven out has been about 80. I will tell you that today, as of this morning, we have put 130 procurements out the door. And that's with some of the year only being a one-man shop.
That's right.
So we've gone from taking 60 days, sometimes 90 days, to get a procurement out the door. If it shows up in the Office of Procurement under Jeffrey Lovingood's leadership, if all the documentation's there, we're going to put it out in 10 days or less. We're meeting that goal. We're doing it. We're going to be successful. And, you know, throughout the county, our EMS and our public safety, they're heads and shoulders night and day better than where we were. You know, we had another company that was sniping our paramedics, sniping our EMTs, and I just wasn't going to have any part of it. So we worked a plan out. We brought it to the board. With the support of this board, was able to put that plan in place. And we are now fully staffed in EMTs. We have 4 or 5 vacancies in paramedics. Fire just brought in 14 new firefighters. We have some folks retiring, so we still have a few vacancies there. But I think across the county, things are much better than we were 13 months ago or however long it's been. Corrections was another challenge, you know, almost 100 down, and we're seeing corrections officers come in the door. I think Chief said they had 30. A couple months ago, he had 30 in the queue to come in. We are now the highest paid correction facility in Northwest Florida. That's by design. That's not by chance. That's through a lot of blood, sweat, and tears, and a lot of strategizing. And you know, then for the non-union represented employees, you know, we brought a creative idea to the table. The board supported it, and we were able to give some really good wage increases across the county. I guess what I would say is, I think we've had a good year despite of all the challenges that we've been through and all the challenges that we faced. And as I said previously, it's certainly not me alone, because nobody does this job alone. You don't do this job and be successful without good people around you, people who have your back, people who you can call and go, "Hey, what do you think about this?" Or, "Hey, Wes, that's a stupid idea. I wouldn't bring it forward." I mean, sometimes it's like that, you know. So I guess, Mr. Chairman and Board, I guess that's my input. So if it's the board's desire that I continue, I would be willing to continue.
That's fantastic news. Happy to hear that, Wes. Happy to hear that. Commissioner Bender and Commissioner May, any objection to us negotiating a contract? Allison? Well, I'm asking Robert, because he's got 2 votes right now.
You know what, I mean, Wes, I think I would agree with well, most, if not everything you just stated. I mean, it is definitely tumultuous when you came on board. You know, I think a little bit like me, we try to find practical solutions to the issues. Leave the personalities at the door and move forward. You know, of course, getting the union negotiations that had been out there for years in some cases closed. I was glad we were able to do that last year. Of course, with purchasing and budget, with Joy back as engineer, I'd say we still have a lot of work left to do with development in some, I'm not saying, I don't want anyone to think I'm saying something I'm not, but, we have, like with the Thompson Bayou that comes every week with flooding and prioritizing those types of issues and so I want to, we need to look at what we're having as a strategic plan for the county, how we're going to address these things, how we're going to address the shortfall in public safety. As I said, I know we went off on the SAFER grants, but I think it's a great program if we know we're going to need these people, that we get something for 3 years to help cover them. They start serving the people of Escambia County, and then we figure out how to pay for them. That's going to be my position on it, and we have the need. I know that we need to get to full staff, and we're going to have to increase EMS staff as we get these new trucks in. And so I think as over the last year, it's been the righting the ship and working through the issues. But as coming in as the permanent, then I'm also going to need to see some initiatives on bigger issues and somewhat taking the lead on those to address them. And other than that, I think I've done a really good job in addressing it, just very practical and manner. So,
Lumen, did you have anything to add?
No, Mr. Chairman. Thank you. I've known Wes a long time and certainly acknowledge what Commissioner Underhill said. But I do respect someone when they don't dodge it. They say, that's what I said, but things have changed. So, Wes, I appreciate that. And, Wes, I'll say, if we have to do an assessment in a public forum, which I don't necessarily think we do, I don't think that there's a better guy at just getting things done than Wes when there are projects. I do have concerns, Wes. I do have concerns about the lack of small and minority businesses and contracts. That's still an issue with me. The lack of diversity of minorities and women within the fire department is a big issue to me. And even sometimes as I sit at this dais, the lack of diversity that I sit as it sits out there is not reflective of this community. So I know that it becomes challenging when you've been in an institution for a long time. But to me, those are the hard things that we're going to have to address. We don't lessen our qualifications, but we certainly have to become more inclusive as a county. And that's the type of leader that I'm going to support, is someone that recognizes that, acknowledges it, and then does something about it. So, thank you, Mr. Chairman.
Okay, Board. Allison, does that, I know we don't take votes on here. But
Right.
Does that leave you, what I'm hearing is we're going to tell this contractor we're done with them and pay them,
Yes, sir.
and that you're going to bring something for us to consider next week?
Yes, sir. If there are any specific parameters,
I'll
that
get
would
with
be
you.
appreciative.
I'll get with you
Appreciate it.
offline.
well, and that was my question is, I know we have a contract. I don't know what else, Wes, you're looking for in a contract, or,
Commissioner Bender, I will probably spend this weekend researching and doing some thinking. I've been here long enough. My leave times are set, my benefits are set, my retirement's set. So there may be a couple things that I will want to discuss, but I will have to put some thought into that.
all right. I hope you just share it with the board. Absolutely. Thank you.
Are you good to go, Allison?
We'll bring something back.
Okay.
Absolutely.
Very good. Any other discussion on that topic? All right, very good.
Allison, we probably need to see it before you bring it back.
We're going to vote on it.
Well, no, but I'm not going to have this long debate in a public meeting. She needs to bring it to
Oh,
me.
sure,
before
sure.
we-
You'll send it to us beforehand.
Yeah.
Oh, yeah, it would be part of your
Yeah.
distributed backup.
Yeah, I
and all
don't see,
that.
I don't anticipate, Allison, a lot of different changes from the previous contracts. You have
Absolutely.
We've done this 4 times.
There was an advertised salary range for the position. I'm assuming we're sort of, kind of looking in that ballpark.
Yeah, that's exactly right. Absolutely. For my vote.
Okay.
All right. All right. Seeing no further discussion, Wes, do you want to set the table on this next issue about Dan Shebler and what we're going to do?
Yeah, thank you, Mr. Chairman. It's had quite a few discussions this week with Ann Schiebler and regarding domes or the medical examiner's office and the construction of a new building or facility, as it's the size, the location, the cost, the methodology to get there, the thoughts and some ideas. And I know there's been some frustrations. I'm sure Mr. Schiebler's been, that he's communicated some frustration, and I don't blame him. I understand what he's trying to get to accomplish. But I think right now we're operating out of Sacred Heart at about an 8,000 or 9,000 square foot facility. I know there seem to be in need of space. It's just how do we accomplish that need or meet that need? And I know there's, working with Walton, Okaloosa, Santa Rosa, and Escambia, there's 4 different boards that have 4 different ideas about how to approach that. And so I know some of you have also had conversations with Mr. Schiebler and maybe some other conversations, I don't know. But with that, I think, Mr. Chairman, you had wanted to have that discussion this morning to hear from your peers.
Yeah, 'cause
and just kind of see where everybody's at and how they're tracking.
Yep. Okay, Stephen and then Lumen.
Thank you, Mr. Chairman.
Stephen.
We'll see. I'll turn it back on when he walks back in. So I think I mentioned this the last time we discussed this. When this first came up, a year ago or whenever it was, the board kind of said, okay, we'll do this, we'll do this endeavor. We'll partner with these counties in this way. I didn't necessarily love that at the time, but that seemed to be the will of the majority of the folks. It was certainly, the intent of maybe it was a little bit more than a year ago. This previous administrator certainly seemed like the will of the administrator at that time. And I just kind of hoped everything was going really well, in that process. Like a lot of things, we try to allow staff to, to manage these, especially when it involves other commissioners, other counties. I don't know that everything was going especially well. Once, when maybe around the budget time, when we first had a first discussion, maybe in June-ish, and it, highlighted some of the financial, impact of what we're looking at. Other counties weren't on board with that original, agreement anymore, or didn't ever come on board with that perhaps. And, it seemed like things were going one direction. So I did take part in a meeting a few weeks back in Santa Rosa County, and, left that meeting, pretty non-committal as far as what I would be willing to support, because of, I said, look, I know these are the ideas that this working group has come together on, but, this working group hasn't really been made up of elected officials that are going to be the ones eventually voting on the disbursement or the allocation of these funds either. So I'm going to have to go back and do some more due diligence. And I've had multiple conversations with Eric Gilmore since then, had been serving on that committee, about trying to find more out about exactly what, more numbers and stuff about exactly what our district is doing versus other districts, and, numbers of autopsies, numbers of staff, numbers of, square footage they operate in, all these things. And, and I have talked to Dan Schiebler a couple times, and I don't dispute the fact that there's an issue with the volume of work that's being done in the current facility. I don't know that any of us would dispute that. I do dispute the deployment of double-digit millions of dollars of Escambia County tax money into a neighboring county, into the brick and mortar. I don't think there's a history of the tax money of neighboring counties going into the brick and mortar where we are currently here. I don't think that was the ask. And one thing I brought up at that meeting, I just said, well, and, was asked what I would want. Well, I was, I think, public in the June meeting and, expressed that again in Milton a few weeks ago. I'd like to see the facility, I'd like to see the facility stay in Escambia County. Just financially, there's, if the footprint that we have doesn't work, what about, doing some due diligence about trying to expand that footprint about where we are? I think that's in my opinion, I think it's a very reasonable conversation to have. What are the possibilities of expanding the footprint in the general vicinity where we are now? If there's any possibility of doing that, it's going to come at a much smaller price tag. Also, I wouldn't be expecting other counties to put a lot of money into that expansion here. If that's the direction we were able to go, I think that's one of the two things that we need to put due diligence into is, potentially whether it's, there may not be room literally in the basement, but it's a very big campus. There may be room somewhere, in the very close vicinity, as well as I think it's worth having a conversation about the facility the Baptist is going to be vacating. I don't think that's an unreasonable discussion.
Yes.
I don't think that's maybe as ideal as expanding the footprint on the campus where we are currently. But if that's not possible, then maybe it's looking at one of the facilities that Baptist is vacating. I brought that up in that meeting. It was said, well, I don't think that's going to work because there's asbestos in some of the buildings and it would take a lot of work. Okay, well, I don't know. They're operating now. They've been there. They've been operating continuously for 70 or however long in those facilities. So I don't know that the facilities are uninhabitable or not able to be worked with either. So I think those two options. I don't know that either one of those has been pursued really to any degree. Eric is still attempting to compile some data from other districts. It hasn't been as easy to get as, from a couple weeks ago when I asked him for it as I thought it would be. I thought it'd be really, really readily available. It's been a little bit harder to get some of that data, but I think we're still working on that. And if what you're looking for, Mr. Chairman, is just some feedback going forward, I think that we should continue down the path of more due diligence on our side about exactly what possibilities may be in those two general locales in Escambia County, and depending on what the outcome of those discussions are, then see about going forward. I understand what might have brought this kind of to a head was, Santa Rosa County either took a vote or at least in a public meeting earlier this week gave an indication they were going to go ahead and acquire property. Mm-hmm. Okay, I don't think that necessitates us making a decision immediately about what we're going to do with it. If they're going to acquire the property, they acquire the property, and we just kind of, commit to moving forward with something. And I left that meeting in Milton, and I don't think it's valuable often to just say, well, I don't know that I'm going to be able to support this idea without ever bringing another idea to the table. I think it's important. I think each of us at different times have mentioned that on this board that, we don't like to just say, no, I'm not going to do this, and I don't have any other ideas. So I think that now is the time that we would be well-served to try to come up with what an alternative idea or multiple alternative ideas might be. It's been talked about, potentially ended up with maybe more than one location where we continue operating here and allow them to operate there and divvy cost up in some manner operationally after doing that. Maybe that's an avenue.
I've
so
asked
maybe
that
there's
question.
a couple. Yeah, maybe there's a couple of possibilities, and once knowing there was a little bit of an agenda change, I have talked to Eric again, and as long as the board doesn't necessarily have an issue with that, I'd be happy to involve myself on the sacred side and try to have some of those discussions with leadership there about about what's possible on that campus, and then if we end up going down that Baptist route, maybe there's somebody that would kind of take the lead with those discussions potentially, and still all the while considering other options.
You had said one thing earlier, I just want to make sure I have my notes correct. You had said that if it's something like an expansion or a footprint expansion here in Escambia County, whether it is, where they're at now and making it bigger or creating something new, you wouldn't necessarily want the other counties to put in on the capital side of it. Help me understand what you meant by that.
So
So we would foot that cost?
I would certainly envision we would be footing most of that capital expense being in Escambia County and be a much smaller, if you're talking about adding brick and mortar or renovating something that, 3,000 or 4,000 square feet or something, I think, I don't know that we're to the point of getting into the details of exactly how much square footage is needed.
Sure.
I think that there are some questions about the Sears
The
wish list
requirements.
of what's actually proposed right now. It's, I think sometimes you folks that, well, what do you need? Well, if I'm not the one having to allocate the money and I'm not the one having to set tax rates, I want everything. Well, okay. I mean, I don't know about that. I mean, so I feel to some degree that's how we've arrived at, maybe the facility that we've potentially arrived at. So, and one of the things that immediately from my discussion in Milton, a few weeks ago was, well, that's, if the facility stayed in Escambia County, that's worse than what's proposed for all three other counties because of the travel distance. Okay, well, it's also would be tremendously less expensive. So, it just seems, so at least in that setting, if we're saying, well, if the facility doesn't move closer to you, that's a negative to you. I can understand how that's bad, but you're kind of bartering. Well, you're not getting the location so much closer to you, but you're also not putting in
The capital money.
the capital money that or at least as nearly as much capital money as is being talked about now. So
Right. No.
I think there's multiple different eventual solutions. I feel like we might be a few weeks or a month or two away from maybe getting to what one or two or three of those solutions might be. And again, if the board didn't have an objection to it, I'm happy to involve myself in that discussion and hopefully, we can come up with one, two, or three alternatives. The way it sits of looking at what's going to be $12, $13 million potentially to us, to a facility being built there, I don't see a way that I can get there. So
Okay.
I don't know where I can get.
That's the value of this conversation, because again, I know it's boring for people watching, but we can't talk about these things. I have no idea where any of you are at. The proposal that I've heard is $3 million from each county up front toward the brick and mortar for a 29,000 square foot building. I'm assured that the cost won't exceed $24 million, although looking at the fire station and the library and just what other things have
No,
actually come in
the-
costing.
The other issue, the other side of that is that Escambia County would take on 50% approximately 50% of the debt service on the
Exactly.
borrowed money.
Right.
So it's the $3 million up front, plus it's at least $6 million on the other side.
Yeah,
So,
that's the deal killer for me. That's
know.
the deal killer for me. And I had the discussion with Dan and Dr. Oleski, and I've talked with Wes numerous times, but I do think there's a sense of urgency, Steve, and I appreciate what you said, and some of that was new that I did not know, and it makes sense to me. But I think there is an urgency. I've been to that facility, and it is incredibly small for what they do. That cooler, the day I was there, they had the bodies stacked 3 high, and they have a special piece of equipment. I mean, it's just,
If there is a potential for an expansion anywhere in the vicinity, that could be put on the ground years before this could be put on the ground.
Oh, yeah,
That
no-
urgency factor, this
I agree.
hypothetically, or even if the footprint at Sacred didn't work and we ended up in a
Baptist.
existing facility at Baptist, the urgency could be met in either one of those locales in a much more timely manner than new construction.
No, there is no doubt that you're right about that. And I mean, now that you mentioned Baptist, I mean, they could keep what they have at Sacred and maybe have an annex at Baptist, and something like that can be turned around much quicker, much less expense. That's good. So that's good feedback from you, Doug, and then Robert. Doug?
Thank you, Mr. Chairman. Yeah, I certainly would hope that we don't entertain too long the idea of two facilities, government providing service at two locations instead of just one. Doesn't sound very good fiscal conservative behavior. It makes a lot of sense for the physical location to be centered in the population served. I think then that's why the state has us operating in this role, as 4 counties working together. So, having it in, I think probably North Santa Rosa County probably makes the most sense. There's very little value actually in physically having it in Escambia County, because keep in mind that public buildings don't create tax revenue. So, while parochially it may feel good to have it in Escambia County, it's a government service that is actually provided across 4 counties, and so we really shouldn't necessarily be county-centric on that. I think that Senator Broxton's proposal made the most sense of all of it, actually about the only sensible thing that I saw in a lot of this discussion, and it balanced the issue of, it actually kind of reflects a similar thinking that created the Great Compromise in the creation of the country, right? Looking at each county putting in $3 million up front, a flat amount that's across each county, and then the remainder of it being covered through the percentages based on use. The beauty of this, and I think that this is Senator Broxton's proposal, and I think that it gives us the opportunity to go, Senator, we all would very much like to do that. How can Tallahassee help?
Right.
And this year is a very good year for doing that. So
and next year.
Yeah, I would think that this would be a very good opportunity to to allow that senior elected official who represents almost all certainly everybody that we represent, plus also just about everybody in this question, right, that's served by this office, to really take a very close look at that, use that as our starting point, and if there are tweaks that are necessary to ensure that Escambia's equities are balanced, then by all means we should do that. But his proposal struck me as being very good, quite frankly, very good statesmanship. So that should be our first point of discussion. I would say, again, reiterate, let's stay away from any discussion about 2 locations. That's not really what compromise is. That's compromise that's to the detriment to the taxpayer. And would agree with, I think, what everybody here has said, is the facility as it stands today is not sufficient for the population that it is intended to serve.
Okay.
So definitely need to move forward.
And I'm familiar with the Broxton plan. The only thing I would say, Doug, is that Walton County hasn't done anything, and there's no indications they're going to put $3 million in. No one's put in the $500,000 budget increase for the operational side. That hasn't happened yet. So, you can draw up the play on X's and O's on the board, but when it's not being run and it doesn't produce the results, it may not necessarily be a good play. So, you take Walton County out of the upfront expense equation, and then that's more on the back end of Escambia County taxpayers based on a proportional share of the debt service.
Interestingly enough, the folks in Walton County are saying that they're not on board because we're not on board. So
that's not the information.
That's not the location issue. Yeah, I mean, obviously we talk to different people, but it's from what I am hearing also is that the poison pill is that it must be in Escambia County. Okay, I don't think that's an equity that the people of Escambia County necessarily would support, or should be a major impact. But and again, I mean, there may be you may have better understanding of where Walton County's at as well. But no, the playbook as presented by Senator Broxton it would in fact require Walton County to be on board for that $3 million. Right. Obviously, if they don't, then that's certainly they're elected officials. They have their responsibilities that they. In how they do their job, but I would be very surprised to see them be unwilling to pay an appropriate share. I think they're good and honest people. So when it's presented by the senator's office that way, and if everybody else is on board with it, I think it'd be very hard for them to say no to carrying the same load that everybody else is carrying.
My understanding is they want to move forward with an a la carte kind of setup where they just pay by the body. They think it'd be cheaper than dumping $3 million into it.
Real quick,
Yep.
To be clear, my position is not that it has to be in Escambia County. My position is if it's going to be in Santa Rosa County, with Santa Rosa County having 3 other counties pay 80% of the construction, that's the issue. If the facility needs to be in Santa Rosa County, but they're only paying 20% of the construction cost. That's the issue. I mean, be happy for it to go to Santa Rosa County. They have the nicest facility that they want. We should be paying for less than 50% of it. You know, and in this event, or even 37.5, which breaks out to be about where that number is. You know, we're 25% up front if Walton came on board, if we're 25% up front, but then we're 50% of the note, give or take. I mean, that puts us at 37, 38% of it, just our county paying, you know, there. That's the issue. It's not where it is, it's the two-part, it's where it is and who's paying for it.
Right. You're right, it's a two-part equation, and on the back end of it, you know, 4 times 3 is 12, plus we're going to get another $1.5 million per year. That's what's going to be put in. You know, whether or not that happens, I mean, I want to take, and I do take Senator Broxton at his word, but a lot of things happen in Tallahassee. A lot of money gets moved around. A lot of things get vetoed, right? Although I'm told this would be put into the FDLE, and that the odds against a veto are low if it's law enforcement. But again, a lot of unknowns, and we're on the hook for the back end of
But,
it.
you know, and the FDLE factor in it is, that's great. FDLE's building a huge facility right now. I mean, if they've got capital money to, you know, to put into something, well, they put it into the facility, the huge facility that they're building in Marcus Point right now.
Yeah, I know.
I mean, that's what makes sense. Or if, you know, if FDLE and UWF and PSC are going to be wanting to partner into this facility, then if we're going to outfit it for other things, we need to get capital from other people as well.
Everyone should put in the money.
That's my point. It's if we're going to bear the brunt of the financial impact, which clearly amongst the 4 counties we would be bearing the brunt of it, we're getting nothing for that.
If it goes in Santa Rosa under this plan.
It's not just has to be this. It's, well, if it has to be there, then I can't participate financially in that, or I can't vote to participate financially in such a large fashion if it has to be there. And if it doesn't have to be there, then, you know, then I wouldn't expect other counties to chip in to the same degree.
Well, that's a part of the equation I wasn't aware of before in terms of our, you know, putting up a little bit more of the capital here to keep it here. I think that makes sense. Robert, your thoughts?
Thank you, Mr. Chairman. I would say that I would agree that we need to be moving forward on this. You know, I think when the Santa Rosa option was thrown out there, they were going to be donating the land on the Commerce Park, and so that was going to be a cost savings. You know, we hadn't necessarily hammered out the percentage cost for each county, but I know our thought was that to move it to help everyone else, we expected to get a little something in return from its current location, because now that's a bigger burden on all of our funeral homes and everybody else that's now having to drive out to Santa Rosa County to pick up the bodies. And so I think we were looking for a partnership with the other counties to help offset the inconvenience that we were now having to have. And I think that, you know, I can see why Santa Rosa and Okaloosa want to jump on it, right? I mean, it's great for them. I mean, if we want to talk about, you know, we have our 3 hospitals here. That's why we've had some of the Santa Rosa County numbers. That's probably why we've had more of the people, the 10% that they're saying are non-residents of any of the 4 counties. You have the people from Alabama that I understand it wasn't necessarily the current administration at the medical examiner's office that set that up, but we've been paying more than our fair share for a long time.
Yes, we have.
And I think that's the other thing that I feel from this board is we want the other players at the table. I don't know why Walton's waiting on us. I mean, I think we'd like to see some commitment from them that they're even at the table.
Right.
And they keep going back and forth. Now, all we're saying is that we just expect a little bit something in return for the inconvenience that we're now having. I worked with Senator Broxton on this a little bit. You know, I know that we all have difference of opinions, and That's why I went to him and said, Senator, I think we're going to need your help in having all of us get to a conclusion and move this thing forward. And I think adding some facilities or aspects to this building that would help us get some of that state funding, I think that was a good ask. I think there was some question of, what's actually needed. I know that they're now in a second site, off-site of the current medical examiner's office for office staff. Is that something that we need to be building into this building? Is there some current office building that might be closer to the proposed location that they could use instead of building it into the site?
Very good point.
And I think that's the question of, do we need this Taj Mahal, which, you and I have both taken the tour. It's the facilities, the space, but it also sounds like some of the questions that we've asked for previously maybe weren't run into the ground. That we haven't vetted everything. And, in talking with somebody last night, they may not be good options that are being, other options that we're thinking that might be out there. They may not be doable. But I think the frustration is that they haven't been run into the ground. We're still being asked to pay the lion's share, and again, just haven't seen much of a partnership at work.
Okay. Well, gentlemen, I appreciate the discussion. I really don't know where that leaves us in terms of, I think there's still some.
Jeff, I'm actually meeting, I think, with the medical examiner's office today.
Oh,
I
you
really
are?
hadn't had a lot of conversation about it since Bill Edens left and when we were on the committee.
Okay.
So I want to do my due diligence and have a further discussion.
Okay, so Wes, can we add this on the discussion for the next meeting? That we can do some additional due diligence, Lumen can have his meeting, maybe we come up with some alternative plans. I will say, I do like the idea of having multiple choices. It does seem like it's this, and this is the only thing, and it's got to be this. And
I do have a question for Commissioner Berry said something that's a little disturbing or alarming, that we would pay 80% of, what percentage are we paying?
I'm sorry. For which? For the construction?
Yeah, the construction.
37%. That's based on 25% upfront and approximately 50% of the debt service. So that blend would be 38% of the overall construction cost, assuming the costs are where they are,
And in theory, it should go 4 ways, 25, 25, 25.
Well, that was the original proposal, or that was the original thing that our board put forth for the capital construction. And that, I thought at the time all 4 counties had agreed to it. Apparently, all 4 counties had not agreed to it. So that, and if it had to stay in if the facility has to be in Santa Rosa County, and if none of the, if the options locally didn't pan out, again, they may very well not be good options, but.
Well, I
conscience,
think there's some
I don't-
benefit for a county. Like you said, if it's 25, 25, and we had to go 35 and kept it in Escambia County, there are some benefits by having it located in your county.
Sure,
People
law
eat,
enforcement.
Yeah.
Robert mentioned funeral homes, but it's
people eat lunch.
Yeah,
They
so-
pay taxes, they buy
Yeah.
gas, they're closer to it. There are some multipliers if it's in your county. So if it's in your county, I do think that there's some direct benefit. I disagree that it's not. Because if you're working in Escambia, you're going to eat lunch in Escambia County. You're going to pay sales tax in Escambia County. You're going to go to the Circle K in Escambia County. If it's in Santa Rosa, you're going to go to the Tom Thumb in Santa Rosa. That's reasonable for me to believe that there is some benefit for having it in your county, or not having it in your county.
Yeah.
all right, so we're going to bring this next week for further discussion. All right. Yep, thank you, guys.
Mr. Chairman,
Yes, sir.
because I do have to go, I do have one question that for Madam Attorney, and it's kind of been a hot topic, and I've actually talked to Tim, and because multiple people that I know who are very close to me have gotten ripped off by this construction company, and it's been a lot of phone calls. I mean, what's our position? What's our status? And I mean, that's two questions, Allison.
So-
My other question would be, why was this person allowed to continue to operate this long, to take advantage of this many people?
I don't know that I can specifically answer that, but I can tell you that as of 5 p.m. yesterday afternoon, his local contracting license has been suspended. I understand that it has also been suspended by Santa Rosa County, so there should be no more permits pulled by this particular contractor in either county. I do also understand from one of our local attorneys that the contracting company has declared bankruptcy.
Of course
So
they have.
anybody who has
But how long, Allison, how long did we know about it, honestly? I mean, how long, I mean, and I understand we have the Contracted Competency Board, but nobody votes for the people on the Contracted Competency Board. We appoint them. The people that have gotten ripped off vote for me every day and expect for us to have rules and regulations to protect them. And, I'm just coming into the knowledge of it, but people telling us it's existed for over a year and a half of people getting ripped off in our county.
I don't know the answer of when the first complaints came in. The Contractor Competency Board does have jurisdiction over local licensing, and
I understand that, but I would want to know because I am on the Board of
Yeah, I
County
don't-
Commissioners. I mean, I would just say to you or to when did we know about it? I mean, when did the county know about it?
Lumen, I asked Tim that question 2 days ago when I spoke with him, and he said the first complaints started coming in about a year ago, and he said they've taken them in order, they've gone through the process because they have to give due process, right?
Oh, I understand that.
So they've brought them forward, and
Maybe I can't do anything, but I understand. Yeah, it's due
'Cause I-
process, but I can sure sit here and yell and scream and tell people not to be using this company.
oh yeah, but the answer to the question is, according to Tim, was about a year ago we started to get, and then a lot of anger online, and then other people go, wait, you got taken by that guy? Oh, so did I, and then it just kind of snowballed. And the question I asked though, and this is something perhaps we need to have a larger discussion about, is since we do, a function of what we do is license these folks, is the minute we get one of these that's sustained, is there a way to put a limited suspension on the license so that they cannot take out any more jobs, no more jobs, but they can finish until they finish the ones that they have? Is there a way to put a little more supervision on them? That's the question.
May I just answer that? I mean, I don't know if that prevents that. I mean,
Yeah, if they don't have
the
license.
problem is that they've gone in and had these contracts well before they were going to pull a license. I mean, I had someone call and say, hey, they were in the city and they said, they're saying the city hasn't gotten back to them, and all of a sudden you call the city and they said, they haven't filed anything yet.
Right.
So I mean, I understand what you're saying. I mean, I think part of the reason they had let his license continue for the last month and a half or whatever was so that he could make the effort to try to
Right.
pull the proper things and try to make right. And clearly, he has no intention of doing that.
He had to pay like $62,000 toward back pay toward one client and then some fines.
I mean,
but
there's
that
there's a
didn't
lot. And, I would say that, I know personally people that used him that, eventually he made good on finishing their project or came close and, but, I mean, it was a hassle. So, I mean, clearly there's been something going on for some time. I hope the state attorney's office prosecutes
at
this to the full extent.
Yeah, me too.
Yeah.
Well, Allison, if you don't mind, maybe for our edification going forward, if there's more oversight we need to provide on this board, or maybe some more guidance, is there any additional local guidance we can give to our Contractor Competency Board that could possibly prevent this in the future?
we can certainly look at whether or not there might be any way to add some new provisions into your Contractor Competency Board ordinance, but you are over the people you've appointed to that Contractor Competency Board. You could certainly make it well known that you would like for them, when they see obvious problematic cases, to be stricter, harsher.
Well,
that kind of thing.
that's too willy-nilly. The other question I have is when they abstain from a vote, because that's my understanding, there's a number of abstentions that are happening. And I've asked Tim Tolbert, I said, who from the legal's office is allowing that? Abstentions because, well, I can't vote on this because I know the guy. Don't they have to meet the same standard as us?
Sure, yeah.
So why would he be allowed, why would Matt Shaw have allowed him to abstain because I know the guy? We don't need people up there abstaining from a hard vote. We don't do it. We don't do it.
You know, we certainly, we provide advice, which sometimes may or may not be followed, as, you know, just like with any,
Are those members of that board, do they have to fill out? That's right. Well, do
the,
they have to fill out the same abstention form that I do? On
They
the
should.
3 or 4 times I've ever abstained in
They
8
should. Of
years.
course, you've got several citizen committees and boards, and typically it is the case that there is a staff person who acts as the secretary or staffing person for that board, and we do advise that they fill out that same form that's held with the minutes of that particular committee.
But
That's
because
what
I
we
know,
prefer.
because I know someone, that's not adequate grounds to abstain on any of our boards, is it?
Generally, no.
Do we have a lawyer from our office at that meeting every time?
There's someone from my office at all the contractor competency board meetings, yes.
Did that come back to you that, I mean, I'm sorry to bring this up, he brought it up, and
We,
then,
we've, Mr. Moreno and I have talked this morning about this particular issue, so I would anticipate we're going to be addressing it.
I mean, that board needs to know, it doesn't matter if you know them, it's only if it's something that inures your financial game or there's a conflict of interest, like the other one we did the other
Yes, sir.
night. Yeah, okay, well, we'll see. I don't know about that. It's on my Facebook. Well, all right. Anything else for the good of the whole? We're adjourned.